Muy buenos días.
Good morning
Nuevamente,
once again.
iniciando las
Just
actividades
starting
nuestro segundo congreso
our activities
de
for
navegación
our
de
second
pacientes
day
internacional
for
en
Congress
Latinoamérica.
for Latin America,
Y
Patient
esperamos que
Navigation
sea
Congress.
un
We
muy
expect
productivo para todas
and we
las
hope that
personas que nos
it will be a
acompañan
very
en
productive
presencial
day for
y quienes
those
están
with
conectados.
us
Sabemos
in
que
person and
no ha
those of
sido
you
fácil llegar porque
online. We
hemos
know it's
tenido
been
algunas
tough to get
interrupciones
here because we've had
de tráfico
some
acá en
traffic
la
issues
capital de
here
Colombia, pero
in our
esperamos
city,
que ya las
Bogota,
personas
but
puedan
we
estar
hope that
al
everyone
final.
can be getting here as soon as possible.
Es un placer
It's a pleasure
presentarles nuevamente a la
to
doctora
present you
Mandi
once
Chapman.
again, Mandi Chapman.
Nuestros siguientes invitados van a hablar de la
Our
implementación de
next speakers
soluciones
will
digitales
speak about
en la navegación de
implementation of
pacientes
digital
en
solutions
metrics.
in patient
La doctora
navigation and
Mandi,
metrics.
directora del
Dr.
programa de
Mandi,
navegación de
the
pacientes del
director
George
of
Washington Cancer
navigation
Center,
program of George Washington
bienvenida,
Cancer
doctora.
Center. Welcome.
Buenos días. Okay, so bright and early, we're going to learn about evaluation. I don't know. This might be a review if you do a lot of data analysis, if evaluation is your thing. This may be somewhat of a review, and for those who don't do a lot of evaluation, hopefully this will give you some basics to build on. Again, this content is adapted from our CDC-funded patient navigation training. It's been revised significantly, but the starting point was from that module, so I wanted to acknowledge their funding. Okay, so since this is kind of a little bit more didactic than some of the other presentations I gave, I wanted to just lay out what I'm hoping you'll take away from this, describe the importance of program evaluation, summarize what kinds of questions program evaluation answers, identify a framework for evaluation, summarize standards for patient navigation evaluation, and access resources for program evaluation. So hopefully you'll take some of those findings away. So starting with the basics. First, I wanted to mention the significant evolution in consensus-based metrics that resulted from the 2020 publication of the core navigation metrics, or the AONN navigation metrics toolkit. In this, they have 35 metrics for patient navigation, and there are about 10 core metrics to try to help build cross-evaluation, cross-program, cross-institutional data. And what that does is when we collect the same metrics, it's then easier for people in academia to do kind of reviews that look across studies, and then we can look at level of evidence. So this is nice to have as a toolkit and a starting point. You don't have to use all 35, but it's a step in the direction of helping us build that evidence base. I mentioned yesterday the oncology navigation standards of practice, and okay, so that was supposed to be columns, and that's supposed to be circling evaluation. So evaluation is one of the standards of the professional navigation standards of professional practice. The formatting might have gotten a little adjusted. And I'm not going to read through these, but I'm hoping that you'll get the slides, and just wanted to have some standard level setting in terms of definitions of what a program is, what program evaluation is. I've moved to calling stakeholders interest holders because, I don't know, complicated reasons, maybe based on your discretion. But that's why I use the term interest holders in terms of people who have an interest or may value what you're doing. They're an important part of engaging. So those are just some definitions to start. And I just wanted to suggest three main categories for program evaluation. So the major things that we're looking at when you're evaluating a program are, most of us know, does it work, right? Like we're looking at, is this effective? Is it doing what I want it to do? Is it doing what I intended it to do? But there's also other levels of evaluation, including process evaluation, which can inform the intervention or program, and also can inform quality improvement. So evaluation can also inform, can it be improved, and how do I sustain the program? And the font's a little tiny for my eyes right now. So these are also, in terms of patient navigation, some major questions that you might think about when you're designing a program evaluation. So are you meeting the needs of the population that you are serving? Is the program elevating patient experience or the quality of experience that a patient has? What can you do to improve the program and improve outcomes of patients? And does the program demonstrate value to the organization? Okay, so in terms of data collection, you're looking at things like, this is where you have kind of tracking logs, or you have a patient intake page, and you might be capturing, for example, if you're capturing name, age, ethnicity, et cetera, then you can then count all of those from your program, and that gives you this numbers in terms of reach for data collection. But then when you're doing your data analysis, this is when you start counting or interpreting the data. And so you might look at, what is it telling you to inform your program based on those demographics and the number of patients you're reaching and the patient acuity that you are noticing. And then when you're reporting usually to someone who's financing, right? Like either a grantor, a funder, a payer, or organizational leadership that wants to see some kind of return or some kind of value for what you're doing. Okay, so some strategies for program evaluation. This is one of my favorite frameworks for evaluation. It's called RE-AIM, and in English, that stands for reach, effectiveness, adoption, implementation, and maintenance. And one of the reasons I like this framework is because you don't have to use all of the metrics that the framework offers. You can just use one or two, but it gives you a sense of the level of what you're measuring. So if you're measuring reach, it's usually just numbers. You're quantifying what proportion of people did you reach, how many people did you reach, whereas effectiveness is answering the question, does the program work, right? And then adoption is, okay, even if it works, is it adopted in practice? Are people going to actually do this outside of the context of a study or a lab? And then implementation, is the factors that, the barriers, the facilitators, and the various factors that inform implementation in actual practice. And then maintenance, even if it's adopted, is it continually adopted and sustained? So again, you don't have to measure all of these things, but depending on where you are in your program, any one or more of these things might be helpful in describing the value of what you're doing. And there it is in Spanish. Okay, and types of evaluation. I mentioned this briefly before, but formative evaluation is that evaluation where you're getting information to inform what you're doing. So this is where you might be doing focus groups with patients or with caregivers or families. You might be doing interviews with clinicians, but you're trying to, for example, yesterday I mentioned doing a situation analysis. If you're doing a situation analysis or a needs assessment, you're looking at what context are you working in? What are the patient needs? What are the clinician needs? What are the resources of the institution or organization that you're working in? And all of that information helps to inform how you're designing your program so that you can be more specific and more intentional about how you're fitting your program to meet those patient needs and meet the workflow of the clinicians in practice. And then the process evaluation, formative evaluation is kind of informing the process, and then process is, are you doing what you said you were going to do? So this might be sometimes in a study, a supervisor will listen to a community health worker or a patient navigator in terms of their interaction with the patient to make sure that how they were trained is they're adhering to the principles that they were trained with. Or in another intervention, you might have something called a fidelity checklist, and that's where you make sure that, okay, we think this is going to work because we're going to do it this way. And you want to make sure, are you doing it that way, right? How closely are you doing it to what you said you were going to do? And then the outcome evaluation is that impact piece. It doesn't matter. Is anyone better off? I mentioned this framework yesterday, but I like it because it's pretty easy to remember, and it's it's stepwise and it makes intuitive sense. But this is the World Health Organization evaluation framework for patient navigation. And the first 4 steps are really that formative evaluation where you're looking at needs, you're looking at population needs, you're looking at context. I can't actually read it from here, but step 5 and 6 is more about the implementation. So how are you going to get support for your program? And then, as you're implementing in practice, what are you going to do to facilitate that? So for example, there are things that are intentional implementation strategies. One thing you might do is, you're going to hear later about the importance of physician champions. So one implementation strategy that's very strong in the literature is preparing champions, right? So let's say you want to do a navigation program, but instead of just kind of starting on day 1, you think, okay, well, I'm going to focus this on head and neck patients, and before I do this, I want to meet with the lead head and neck medical oncologist and make sure they know what we're doing and that we're aligned with what their priorities are and they see the value of this, because it's really powerful to have that champion behind you. So the implementation piece is really thinking about those things and being intentional about how am I going to make sure this works. And then step 7 and 8 are more about adoption and then monitoring for refinement, right? So bringing in data so you can look at it and say, okay, well, this is something that's a little different than what I assumed, so how can I make the program better? Okay, so ways that you can capture evaluation metrics, data sources. So if you have an electronic health record, that's a great tool. It's not always easy to manipulate data or get data out of it. It's kind of more designed for billing, but it can be a very robust and important source of data tracking, depending on if you have IT support and what you're capturing. In the US, we have a pretty robust cancer registry database, and that allows for surveillance, our kind of broad reports from SEER data, from our behavioral risk factor survey data. Well, actually, it's not registry, I apologize. But it's also a nationwide data database, the BRFSS. Tracking logs could be as simple as Excel, right? Like creating columns or tracking what you feel like is meaningful in your program. Administrative data, that might be important in terms of looking at time points, or if you need to look at insurance claims or amount billed. Meeting summaries, interview transcripts, notes, those are all qualitative, so those are more the story or the kind of what's behind a number. And then survey results. So if you directly survey patients or other interest holders, that's a more quantitative measure. Okay, again, for process evaluation, I made this too tiny. I'm going to go ahead and read these questions, though. So process evaluation answers the questions, what was done? How was the program implemented? How well was the program implemented? Was the program implemented as planned? How satisfied are patients or healthcare team members with the program? And how can we demonstrate program implementation even before outcomes? So you'll notice nothing here talks about if it mattered, right? It's all about the process. It's all about how are we going to do this? Did we do it well? Did we do what we said we were going to do? And then these are examples of process metrics. So you might count. I think one of the most important things to count in patient navigation is barriers to care. So that's a count. It's a process measure. You don't know quite yet whether you've made a difference, but quantifying how many patients have a barrier, what the barriers are, These are all these formative kind of data. Other things, oh, thank you so much. Thank you. I'm not sure if oh, there we go. Okay, thank you. Time from diagnosis to treatment, health economics. So that's, for example, if you're looking at hospital readmissions, that deeply affects hospital economics. Psychosocial support, how many patients are navigated to support resources. But all of these things are kind of numbers, quantities. Again, so they're helpful in terms of saying what you did. And then outcomes evaluation is saying, again, is anyone better off, right? Like, so you did what you said you were going to do. Does it matter? Was our program effective? How did this actually impact the patient? We're assuming a positive impact, right? But actually looking at were outcomes improved, was patient satisfaction improved? And then what evidence demonstrates to administrators, funders, and other interest holders we should continue to do this program? Okay, and so other ways for data collection, again, from the EHR, patient records abstraction, you can directly survey. There's lots of validated surveys you can use, and sometimes you need to create your own depending on what you're trying to assess. Interviews, again, are a good source of qualitative data. Focus groups also for qualitative data. And then figuring out your data and analysis plan is based on your method. So if you're extracting data from the EHR or you're doing a survey, that would be quantitative, and interviews and focus groups would be qualitative. And again, there's ways to track your own records or leverage technology that's capturing information, but you want to make sure that whatever it is that you're deciding is most important is captured consistently and accurately. This is an example of a demographic form that my team created when we were creating our team training. And we wanted kind of a friendly, patient-facing demographic form that would ask about name, pronouns, religious preferences, other things that the patient wanted a clinician to know about their care. So that's available free of charge. Like everything that we have, you can adapt and use it if it's helpful. I mentioned this yesterday too, and this is an Excel-based evaluation tool that's available. If you receive the slides, you can click on the link and you can obtain a link to the site for this, but it captures numbers of patients, patient testimonials, barriers, actions in response to barriers, and there's some automated reports that you can generate. Okay, so that's a lot of information, and if you're an evaluation expert, that's probably really basic, and if you're not, that probably felt like a lot of words. So, you know, you don't have to capture everything. What you really want to think about is, you know, sometimes we get lost in, oh, I could count this, and I could count this, and I might be able to measure this, but what you really want to think about is, what do you need to show for population impact? What does the patient care about? What does your funder care about? What does your organization care about? And like, what are your strategic imperatives at your organization, and how does your program relate to that? And so really looking at the really key interest holders and what they care about. And then you can pare down your evaluation and be really intentional about what you're capturing based on telling that story. Here are some additional references that I mentioned today, and again, a way to stay in touch with me. So hope that that was somewhat informative. Happy to take questions. Yeah.
Le agradecemos a la doctora Mandi y
We thank Dr. Mandi, and we invite Dr. Maria Rojo, expert in digital health of Intramed Argentina. She's with us remotely. Welcome, Dr. Marina.
Hola, ¿qué tal? Gracias.
Hello.
Gracias.
Thank you.
Doctora, usted tiene su presentación, ¿la puede compartir?
Can you share your presentation?
Desde acá la también.
We have it.
¿Eh?
Okay.
Listo. ¿Está perfecto ahí?
Ahí vamos.
Adelante, doctora.
Bueno,
Okay.
gracias por la invitación.
Thanks
Ante
for
todo,
the
me
invitation.
presento,
Before
cuento un
everything,
poco, quizás,
let me present myself and tell you a little bit about me and what I do, which
con esta
has
presentación.
to
Yo soy
do with
médica.
this
Durante muchos
presentation.
años
I am a
trabajé en salud
physician.
pública,
I've
esa
worked
fue mi
in the
disciplina
public
inicial,
health
y de a poquito me fui
program.
metiendo en el
This
mundo
has been
de
my
la
sector, and bit by
tecnología.
bit, I've been
Eh,
working with
en
digital
función de
health.
esto, digamos,
In function
uniendo
of
quizás
this,
un poco los dos
joining
mundos
maybe
y
both
en relación
worlds, and in relation with
a la ponencia anterior,
last
lo que les voy a
our
contar ahora
last
tiene que ver
speaker's
con una cierta
presentation,
evaluación
I'm
que
going to speak a
hicimos
little bit
de
about
soluciones
some sort of an
digitales para la
evaluation
navegación
we
de pacientes
run for
oncológicos. Esto
oncological patients
surgió
digitally,
con
and
una
this was
convocatoria
started
que
with a
hizo
call
una
made
organización
by
internacional que se llama
an
City
international
Cancer
organization
Challenge.
called City Cancer
Quizás los que
Challenge
trabajan en
that
este,
maybe
en
those of
este
you who
campo
work
ya
in
la
this field,
conozcan.
you
Y lo
may
que estaba
know
buscando
about.
City
And
Cancer
what
Challenge
City Cancer
era
Challenge was looking for
de
was
alguna forma brindarle
somehow
una
to
herramienta
deliver
a las personas que tenían
tools
que tomar
for
decisiones
those
sobre
decision
elegir o no, y en
makers
todo caso, cuál era una
or
solución
those who
digital
had to
para acceder a
choose
las navegaciones de
the
pacientes
digital decisions
en
for
función de algunos
navigation
criterios
in the face of
digamos, que
several
nos costó tratar
criteria.
de
And even though
encontrar
it
un
was
punto. Y a partir
rough
de
to
eso crearon un
find
grupo de trabajo que yo
a meeting
coordiné
point,
durante algún
they created
tiempo
a
y les
work
voy a contar
frame
esa
that
experiencia.
I
También les quería decir
was a part of
que
for
estamos intentando publicar esta
some
experiencia
time. We are
en
trying to
un
publish
paper,
this
así que
experience
esperemos que tengan
in
tiempo
paper.
para
Let's hope
compartirlo
that
con
we have this
ustedes
publication ready to be
esa
shared with
publicación.
you soon
Y
about my
nombrar
experience, our experience in this work,
el
and
resultado de esta
also the
evaluación
outcome and
específicamente.
result
Yo no
of
voy a
these
hablar hoy de
evaluation. I'm
cuáles
not
fueron las
going to talk
soluciones
about the
finalmente
solutions
seleccionamos, sino que
that
les
we
voy a contar cuál fue
finally
el
chose, but
proceso.
I'm going to
Pero
tell you about
pueden
the
consultar las
process. But
soluciones,
you
están
can find the solutions also
digitalmente en una biblioteca
digitally
como
in a
City Cancer
library
Challenge, donde
available with
las pueden consultar
City
si
Cancer
les
Challenge
interesa.
that are is there for consultation.
Pasamos a la
Can you
siguiente.
can you next slide, please?
Bueno, ¿qué desafíos
Okay,
encontramos
so
cuando
what challenges did we
desde
find when we
entonces
started,
nos preparamos
and
para
what was
realizar
our
esta
starting
evaluación?
point for
Claramente, digamos,
these
el cáncer es un
evaluation?
tema
Clearly,
de
cancer
urgencia a
is
nivel
a
mundial y en
very important
Latinoamérica.
topic
Pensábamos que
worldwide
había
and in
algunos
LATAM.
desafíos que
We thought there were some challenges that
los países
specifically
de medianos y
are
bajos ingresos, ahí cuando digo
middle and low
estamos
income
hablando de
countries
eso, enfrentaban,
faced,
como infraestructuras
such
fragmentadas,
as
diagnóstico tardío,
disjointed
tradicionales,
infrastructures,
que
late
hacen que los
diagnosis,
resultados que tenemos a nivel
not
supervivencia
enough
de pacientes
professionals,
sean
and
inferiores
on level of
a bajos
survival makes
ingresos.
us being
Y
on
por eso,
lower
bueno,
levels than high income
surge el
countries,
tema
and
de navegación de
hence
pacientes como una de
the
las soluciones,
navigation, the
pero
patient navigation topic
específicamente
as one of
la
the solutions,
pregunta
but
era, bueno,
specifically the
¿hay
question
algo
was,
que las soluciones
is
digitales
there
puedan
something that
agregar
digital
a la
solutions
navegación de
can
pacientes
improve to
para
patient
hacer una
navigation,
solución transformadora que
to be
apoye
a
a los programas
transformative solution that
tradicionales
will
o
support
inclusive
other
hacer algunas
programs,
soluciones
or
digitales que
even more
fueran
so,
totalmente digitales, que
have
no
other digital
necesariamente
solutions that
un
were
programa más
different and that
tradicional
were more independent,
podían este
and
tipo
that
de
could
soluciones
also
superar
these
las barreras
solution
de acceso que
overcome the
tenemos
access barriers that we
y
have,
especialmente cómo hacíamos
and
para evaluar
especially
estas
how
soluciones.
could we
Recién,
evaluate such
digamos,
solutions
vinculando con lo
recently,
que Mandi
and
comentaba,
also has to do with what Mandy was
digamos, en
talking
algún
about.
punto nosotros no íbamos a hacer esta
Somewhere
evaluación porque no
we were not to
éramos
do
nosotros los
just an
que estábamos a
assessment or an
cargo de
evaluation, because we were
implementar el
not
programa ni de
in
evaluarlo,
charge of
pero sí
implementing a
queríamos
program or
darnos de
evaluating it, but we
evaluación
wanted to
sobre este
gather
tipo de
data
información
from
de
other
todas estas
evaluations,
soluciones digitales
from
y de alguna manera
other digital
integrarlas
solutions, and somehow
con alguna
integrate them
herramienta
to
que
set
facilitara
a
la toma de
tool that could
decisiones. La
facilitate
siguiente, por favor.
decision making. Next, please.
Bueno, y preguntas específicas que nos
Specific
hicimos
questions
cuando
that
empezamos
we
a
had when we started
desarrollar este
to
marco de
develop
evaluación
these
era
evaluation
si una
frame
misma solución
was if
podía
one
adaptarse
solution itself could be
a un país
adapted
de medianos y bajos
to
ingresos y en todo caso
LMICs,
no era
if this was not the case, if there were specific aspects that we needed to take into consideration, which were these specific aspects? A little bit of, and those of us that work with technology and digital technologies, we face this question a little bit, that is sometimes
como futurísticamente, como si a los
seen like a future question, if we are to be replaced by AI or these sort of tools, or if they are a complement that help,
a que hagamos mejor y a
that
hacer más
we
rápido
are
nuestro
better
trabajo.
and faster doing our jobs, what limitations existed regarding low digital literacy of patients, of navigators, of professionals, of everyone involved in using these tools, and later other aspects that raise when we evaluate digital solutions that have to do with legal regulatory frames within every single country, and how much are we taking them into account for the solution, and what aspects for countries that don't have so developed frames, because you're tempted when you don't have specific regulations to take like the highest standards, the laws from whatever part of the European Union or the United States regarding everything, protection of data and security of the patients. But it is true that when you take these frames and you apply them, most of the times these solutions that have been evolved and developed specifically for Latin America don't have
cumplimentar
the
ese tipo de
scope
estándares.
to
Entonces, también una
complement
pregunta
these
era
standards.
si
And so
deberíamos
question
tomar
was
marcos
that should
o
we use these frameworks or
simplemente poner algunas
simply just
cuestiones
use
más básicas
some
y dejar
basic
después
points
que cuando
and
fuere la
then leave
implementación en cada uno de nuestros
space
países
open
se
for
mire si
interpretation
ese
given the
régimen
context
particular
of
aplica o no aplica a la
every different
legislación del
country,
país. Pero sí
according to the
había un
law
cierto
of that
consenso en
country.
que
But
no
we
había un marco
agreed that there
desarrollado
was
para
not a
evaluar este
framework
tipo de
developed
soluciones y
to
que
evaluate these solutions,
desarrollarlo iba a ser de
and
utilidad.
develop it
La
would be
solicitud.
useful for us. We agreed upon this point.
Bien, entonces nuestro objetivo
And
principal
so our
fue
main
desarrollar el
goal
marco
was
para
to
empezar a evaluar
develop the
estas
frame
soluciones.
to evaluate these
También lo que hicimos
solutions.
fue
What we
evaluar
did
algunas
was
soluciones. Tuvimos
evaluate
una primera
some solutions
ronda
as a first
de
round
presentación, que también les cuento
presentation.
un poquito cómo
And
lo
let me tell you a
hicimos
little bit
ahora.
how we did
Pero
it.
nuestro objetivo era
But our
como
main
empezar a
objective was to validate
setear algún
or
tipo de
set
marco que nos
some sort of
permitiera
framework that would allow us
evaluar
to
estas soluciones digitales.
evaluate these digital
Queríamos
solutions. And so we wanted to
clasificar y evaluar estas soluciones
classify
que ya fueran
these
existentes,
solutions that
identificar
pre-existed,
qué desafíos
identify the
fueran
challenges
únicos de
that
los
were
países
unique for LMIC
bajos
countries.
ingresos. No hablo solamente de
I'm not
Latinoamérica
speaking
porque
just of Latin
los temas
America,
específicamente
because
sobre el
specifically
challenge
City Cancer Challenge
ellos
has
trabajan con varias ciudades
an
y también
operation in
ciudades
different
en África,
cities, in
en Asia,
Africa, in
no son
Asia,
específicas
in
para
other regions.
Latinoamérica,
This is
pero
not
sí para
specific
países
for Latin
que
America, but
hemos categorizado
it's
como de
specific for
medianos y bajos
countries
ingresos,
categorized as
poder recomendarles una
LMICs.
serie de
We
recomendaciones
could
para tomar
give some
decisiones
recommendations
y
for
que estas
decision makers,
recomendaciones además
and
fueran
that
en
these
algún
recommendations
punto
were
accionables, no
somehow
teóricas,
actionable
sino
recommendations, not
que
theoretical,
pudieran
but
traducirse
actionable, could
en
be
hacer concreto.
shaped into
La
concrete
siguiente.
measures. Next.
Bueno, ¿y cómo fue nuestro
And
proceso
how was
de
our process of
construcción de
construction
todo esto?
of
Hubo
all
dos
this?
procesos que
We had two
corrieron en
processes
paralelo.
that
Uno tuvo
were
que ver con
parallel. One
desarrollar
had
este
to
marco
do
de
with
evaluación
the
y el
development of the
otro,
evaluation frame,
ir armando
and
un
the other
proceso de
to set
evaluación
the
en
process
paralelo.
for the
En relación
evaluation.
al marco de nuestro proceso de
In
evaluación,
relation to the
lo que hicimos
frame
fue
of development,
arrancar
we
consultando
started
otras,
consulting
sobre todo
others,
organizaciones, hay
most of
organizaciones
all
no
organizations,
gubernamentales y
NGOs,
también
and
organizaciones de algunos
also
estados que tienen
some
oficinas de evaluación de
entities from
tecnología.
states that have evaluation
Específicamente,
assessment
me
offices
parece como lo más
specifically,
importante
and I believe this is the most
recomendarles,
important
además, porque fueron los
thing
marcos
to
que más
recommend you,
sirvieron.
because this was a
El
very
Sistema de
useful
Salud en
framework
Inglés
of the
tiene
English
desarrollado
health system. They
últimamente es
have
DTAC,
that
DHS, tiene
DTAC.
desarrollado una cierta
They've developed some certain of
evaluación de este
guides
tipo de
to run evaluations of these technologies. And there are two others, DIGA, which is the German agency, and also APA, which is the American Psychiatrist Association. These are all organizations that come from way back developing these evaluation frame. The Psychiatrist Association is specific for mental health related things, but we took some of the questions and more some of the dimensions that I was telling you about that we selected for evaluation. The German agency also has a robust, highly developed framework, and it's interesting because some time back they've been using this framework to see if these digital solutions that are most of the times applications and that the professionals hand out like prescriptions are evaluated, and when they are approved, the professional can prescribe as if it was a medicine. But what happens is that the coverage of the health that the person has needs to finance a part or whole depending on the rule of coverage. But there is an acknowledgement from the system that this works and that
es una solución
it's a
digital
solution, a digital solution that must be financed within the coverage. And so we take all these frameworks, we took all these frameworks and we described the dimensions, crossing them over with a team of people that we answered to different organizations, and we had different profiles because when the group was set, the idea was that it was not people who had the same background,
but that we could contribute from different viewpoints. So there were people with a lot of experience in patient navigation, in navigation programs, like a physical, non-digital programs, and some people like myself that didn't have no experience in navigation programs. I knew what they were about, but I had not participated ever of something like that. But we did have experience in public health from the side of technology validation, doing digital technology, and so we set up a teamwork work team that joined every month. I was the coordinator. I was responsible for scanning all the frameworks and presenting them to my colleagues in an organized fashion so that the rest of the team could decide what should we include, and we omitted from that evaluation because it could not, of course, be an endless assessment. And on the other hand, we started to shape this evaluation or process that had this open call through social media and through the organizations that were part of this group. As I mentioned, many people that are part of patient navigation organizations. So through those organizations, we also made a call and we received 63 applications. One of the matters that we saw when we got the applications is that there were certain presentation of digital solutions that were not specifically about patient navigation. That one might use it, for example, electronic medical record. To give you an example, an electronic medical record is not a digital solution developed to support the patient navigation process, even if you have certain follow-up tools or you extract the data and you check and analyze the patients, like one might interpret, yes, but that's what they applied. But we had to make a definition to say these solutions correspond and these solutions are left outside. So after those 63 applications, we kept the 42 solutions, the short list, and then they were shortlisted to be included, 11, one of them to shortlisted to be included in this library. About this selection process, we prepared a questionnaire that we ourselves, the evaluators, had to complete It was not that they were completed by the people presenting the solution. In the application, there was a first questionnaire. What happened is that the first questionnaire wouldn't give us all the necessary information. Generally, there was a link. Sometimes it was to a site that were solutions maybe larger. They had a website. There were some others that were forums sometimes, and they didn't have a site. So what they would give us, it's a PowerPoint with certain description. We reached the conclusion that we needed to have a conversation with the applicants and that we needed, if possible, to have a demo. So we split into two groups. There was always like two evaluators during the demo. But these 42 solutions were presented what they were about, and just there we were able to have a much better understanding than the description that we had got. In that sense, well, it was the selection was a lot of work. First, passing all that, preparing the evaluation framework, and after that, with the team, sitting down and getting these demos. And I tell you this in terms of having a dimension of the effort that is required for this kind of evaluations. And that's why also at some point the importance of when you do that, being able to share the results so that other people can take advantage of that evaluation. These 11 that were selected, 5 of them were developed low and middle income countries, others were not. And the last is what I was telling you about with this evaluation of demos.
Bueno, y acá quizás
Well,
tenemos un
and
poco
here we have
lo más importante
the most
del marco
important
que
of the
desarrollamos,
frameworks that we
que
developed.
fue,
That was
digamos, iterando entre los miembros del grupo
iterating
hasta que
in the
llegamos a
group
estas
members
7
until
dimensiones que para
we
nosotros
got to
eran
these 7
críticas
dimensions
y
that
que
were critical for
definían
us,
si
and that
estas
defined
soluciones
whether
iban con
these
nuestra biblioteca
solutions
o
were going to
no
be
para el hecho
included in
de
this library or
desarrollarlos
not.
de alguna manera. La
Somehow.
primera tenía que ver con el
The
acceso.
first one had to
El
do with
acceso
access. When we talk about access,
es la facilidad
is the
que
ease
los usuarios,
for
además
the
en las soluciones
users.
tienen
A
usuarios
lot
con
of times these
experiencia, sino
solutions have
usuarios
users
son
that are patients and
funcionarios.
users that
Entonces hay
are
que evaluar el
professionals.
acceso
So we
desde
need
esas
to
dos
assess the access from
Una
those two
solución digital
viewpoints.
puede estar en la
A
web,
digital solution
puede
might be on
tener
the
una
web,
aplicación.
might have an
Esa
application.
aplicación puede
That
funcionar en
application
distintas
might
plataformas o puede
work in
ser para
different
una sola
platforms
plataforma. Bueno,
or for a single
factores hacen al
platform.
acceso,
All of
sea lo que
those
tenga o
things
no
to
tenga
that
funcionalidades
access.
online.
And they might have
Muchas
online
veces
features or
pensamos que
not,
cosas que
because a lot of times
solucionemos
things are
100%
developed
online
that are
en la
100%
nube y
online
después la realidad hace que en
in the cloud,
muchos
but then the
países en
reality
las que
makes that
menciono,
in many of the
por ahí
countries
no
in
estamos
our
más
region,
alejados a los centros
maybe in
geográficos, el
the
acceso
hardest
a
to
Internet
reach
puede que siga
points, the access
siendo
to internet is
una
still
barrera que hace
a
que,
barrier,
digamos, uno
the
no pueda estar
problem,
conectado 100% del
because
tiempo.
there's
Entonces,
no
tener
connection 100%
una
of the time.
parte de
So first,
funcionalidad
we have
offline,
a part of
solamente porque yo me conecto a
offline
Internet se
feature
sincroniza y transmite
that
los
would
datos,
sync when
era
you are online,
un plus.
and that would, yeah, that would be
Toda
a
esta
plus.
parte de entender
So
qué
all
sistema
this
operativo
part to
corre, qué
understand
es una
the operating
plataforma,
system
era
that
una primera
runs the platforms,
evaluación.
it was
La
like a
segunda,
first
dice,
evaluation. The
interoperabilidad.
second
La
one was
interoperabilidad es un concepto muy
interoperability.
de la
Interoperability,
informática en
it's
salud y
a
tiene que ver
concept
con
of
que
health
distintos
IT
sistemas
that
puedan
has to
dialogar
do with the
entre
fact
sí.
that different systems
Esto es
can
fundamental
talk to
para
each other.
que
This is key
las soluciones
for
puedan,
the
por ejemplo, tomar
solutions
datos de una
to
historia clínica
take
o enviar
data
datos a una
from
historia
a
clínica o
clinical record or
otros
taking
sistemas, por
information
ejemplo, un portal
or
de
connecting to
pacientes.
other systems, for
Es
example, a
muy,
patient portal.
digo,
So it's
es muy grande y
very
variable la cantidad de
big
soluciones
and
digitales
variable, the
que
amount of
podemos
digital
pensar y las
solutions that we
integraciones.
can think
Y
of,
la
and
realidad
the
es que
integrations.
hoy en
And
día
the
en el mundo de
reality
la
is
salud, el tema de la
that nowadays in the
interoperabilidad
health, the
es
aspect
un
of
problema. En
interoperability
general, las
is
personas
an
que
issue.
desarrollan
In general,
soluciones,
the
sobre todo
people,
cuando
those who develop solutions, and
nacen muchas
especially
veces
when a lot of times it comes from wanting to solve a problem. In practice, they develop systems that are known as monolithic or standalone, that are systems that start in themselves, small ones. So maybe a small application to record certain data or certain reminders. And a lot of times, when they are developed from a health service or with the professionals in general that maybe use or get some type of grant to do those kind of things, they don't, those systems, they don't talk or don't communicate with the large systems for medical records or patient registration. So interoperability, it's important. There are standards that have to do with there are standards for how the system communicate to each other, like electronically, some protocols, and also about how the concepts are saved. There are particular nomenclatures. So, for example, probably there's one that is quite familiar, that is CI10, all the systems that we have to classify the diseases and the causes of disease. That, for example, is standard. So if I classify some the health issues that I am following with a standard, they might match, or they might be some other more complex that were developed. So I have much more opportunities for the system that I am developing can talk to other, because when I already send the code, J22, on the other side, the system already knows that I'm talking, I don't know, about some pneumonia or something. I don't remember the specific codes.
Pero eso es lo que se llama,
But
digamos, un estándar
that's what is called a semantic standard. When a system is developed with those characteristics, it has that possibility to interact with other systems. So this is another dimension that we were interested in evaluating. And the third one, and this is the first three dimensions I'm talking about, were like the initials. Then we designed like an evaluation that was by phases. These three: access to interoperability and data protection and security, were like the technical dimensions. And what we define is that we have like some ground or technical dimensions that we require for these applications to meet to go to a second round of evaluation that was quite more was more complete and had to do with this clinical aspect. So the third dimension was the protection and security of data. Here we were interested on the one hand, where was going to be the data and the patient information be saved, that usually sensitive data, as I said at first, it has certain regulations like personal data protection standards that need to be met. And there was another dimension that it was not that it should be saved in a safe place, safe location, but also what we needed is for the patients to be able to, or at least we wait like something important for the patients to be able to define if the data were going to be saved or not. Once the applications pass its first technical evaluation, we would go to the clinical foundation, the user experience, and especially the costs. And here is where we had most of the difficulties, because a lot of the solutions that were presented, I think that we went from 42 to choosing just 11, they didn't have a clinical foundation. So it means that they had never been evaluated as mentioned by Mandi to check whether the effectiveness was real or not. And that was key for us, because if we don't have a clinical evidence that it actually these solutions have been implemented and at some point were evaluated, I mean, we could not say that there was evidence for it to be selected and implemented. And finally, and rounding up, the other dimension was cost. There were paid solutions, there were free solutions, but usually the cost aspect was not clear for us to be able to make that estimation of cost effectiveness. That would be the appropriate form to evaluate a digital solution. And finally, we have to think, well, can it be adapted to the real conditions, and especially whether it had been implemented or not in a country.
Y ya con esto terminamos. Y bueno, para
Well, we would
resumir, lo
finish
que
with this, and to
terminamos
summarize, what we ended up finding is that there was a diversity of solutions that proposed different things with different categories and approaches. There were many that were especially designed for oncology, and they had good usability and accessibility, but we had no evidence that the clinical dimensions and the financial ones about the costs were actually cost effective. So we were still missing this instance of clinical validation of this type of solutions, so that we could actually suggest that they could be used. So
hasta acá llegamos, creo que en la
I
última
think that
están,
this is it. I think that the last one, yeah.
mis datos de contacto y ese tipo de cosas.
That's my
si les interesa
contact
algo
data
específico
and
de
that kind of things, if you are
esto. Y
interested in
nada
that.
más. Muchas gracias por
And that's it. Thank you very much
la
for
atención.
your attention. Wait, Nancy Peña, we have two questions over here. So then the public can ask the questions. The first one is, what digital solutions have you thought for elderly patients with cancer, with the evidence proves that it's a barrier for the digitalization in health is a barrier for that population?
Okay, sounds good. So, Marina, buenos días, ¿cómo estás? Bienvenida. Entonces, si tú puedes, por
Welcome.
favor.
So, Marina, so if you can, maybe,
Sí,
do you hear the
Sí.
question? Yeah.
Antes que nada, digo, nosotros no pensamos
Before
ninguna
than
solución.
anything, we
Nosotros
didn't
vimos
think of any
soluciones y
solution. We
evaluamos.
got
El tema
applications and we
de,
evaluated them. The aspect
mayores
of
es un tema
the elder
igualmente
patients,
en la experticia que
it's
se viene
a topic
desarrollando,
in the experience that we have been
esa creencia de que
developing this belief
mayores son las que tienen
that
mayores
the
dificultades en
elderly
el
populations
acceso
are
no se
the ones that have
constata
most
muchas
difficulties
veces
in
en
the
la
access.
práctica.
Sometimes it's
Lo
not
que termina
verified
pasando es que
or
todos, sin
proven in
duda,
practice.
tenemos
What ends up
dificultades en
happening
el
is that
acceso,
everybody
muchas
has
veces en la
sometimes issues in
utilización.
the access and in
Hay
using.
algunas cuestiones
There
ligadas a la
are some aspects
usabilidad
related to
que se pueden
usability
desarrollar con
that
pantallas
might
más
be
grandes,
developed
pantallas más
with,
grandes, cosas que se van
a
adaptando. De hecho, la
larger font,
usabilidad
big.
era una de las
Actually,
cuestiones que
usability
nosotros
was one of the
evaluábamos. Tiene
dimensions that we
adaptaciones para por
evaluated.
ahí personas con
If they had
visibilidad
evaluations, maybe
disminuida.
for
Todas
people
esas
with
cosas sí existen y se
lower
pueden evaluar.
visibility,
Y hay
all those
soluciones
things
que
exist and they can be assessed.
trabajan específicamente
And there are solutions that
mejorando
work
esas
specifically in improving those characteristics.
Muchas gracias.
Thank you very much. So the next question that you have, for Dr. Mandi. Most of the times, patients tell that they are happy with our support as patient navigators. But how could we actually measure the impact of our support in the patient's quality of life?
Yeah, that's a great question. So there are lots of ways to, sorry, I'm hearing Spanish and English in my ear. There's lots of ways to measure. For patient satisfaction, there are validated tools, and when you have a construct like satisfaction that's very broad and has been used a lot, using validated tools are helpful because what that gives you is basically a tested item. So the way the question is asked and the answer options that are given have been tested. So you're more likely to get the data that you're actually hoping to get. So there's promise measures that the National Institutes of Health in the United States developed, and those should be freely available. And I know they're available in a lot of different languages, but those promise measures have been validated, and there are items that ask about satisfaction, there are items that ask about quality of life, functionality. So that's definitely a place to start. There's also a very commonly used tool called the FACT or the FACET that a colleague at Northwestern developed, and I believe that's also freely available. It's frequently used in research. It's a very short instrument and can measure quality of life without asking a ton of questions. So that's probably where I would start if you wanted to kind of quantitatively measure that.
Okay, well, voy a hacer algunas preguntas en inglés y otras
Okay, I
en
will
español.
ask some questions in Spanish and some others in English, but first, yeah.
Well, primero que nada, gracias
So
a
first,
ambos
thank you
panelistas.
both
En EPI
speakers.
también
And
participó
PI
en el
also
estudio
participated
que la doctora Rojo
in the
estaba
study
presentando
Dr. Rojo
y
was
también tuvimos
presenting.
oportunidad
And
de
we also
revisar
have
estas
the
aplicaciones.
opportunity to
Ahora
check
bien,
these applications.
obviamente
Now,
como navegadores de
of course,
pacientes,
as patient
a veces
navigators,
tenemos estas
sometimes we
limitantes
have these
de en qué
limitations
tipo de base de
about
datos
what
vamos
type of
a
databases are
tratar.
we going to be
La doctora Marty
working the metrics.
Pratt-Chapman presentó
Dr.
una herramienta
Chapman
que
presented a
tienen
tool
en George
that they
Washington
have in George
que también
Washington
ustedes
that
pueden
you
adaptar
can also
y
adapt.
pueden,
And
obviamente como es
that
en
can,
Excel,
of course, since it's
pueden
in a
adaptarlo a
spreadsheet,
español.
you can
La
adapt it to
pregunta para
Spanish.
la doctora
The
Mandi
question
es,
for Dr.
bueno, a
Mandi
veces
is
tenemos programas
sometimes
que están
we
iniciando
have
navegación,
programs that are
¿verdad?
just
Que estamos
starting
invirtiendo muchos
navigation.
voluntarios que tenemos en
Volunteers that
hospitales
we
también
have in
que no tienen
hospitals
acceso,
that
tampoco tienen
don't have access and they don't have
recurso para
the
cubrir
cost
tanto
of the
para
funding
una
for
plataforma muy, vamos a
very
decir, desarrollada,
developed
como regularmente
platform
pasa en los
like
Estados Unidos.
usually happens in the
Entonces la
United
pregunta
States.
acá es si,
So the
por ejemplo,
question here is
utilizáramos
if
su
we
aplicación, las
use
métricas que
the
usted
your
provee
applications, the metrics you are
gratuitamente.
providing that are free.
La primera pregunta es, por ejemplo,
The
para un programa de
first question is for
navegación que es intro level,
navigation programs that is
no like
intro
no es un
level. You know,
programa
it's not like
que estamos
a
viendo 1,000 pacientes, pero que estamos
program that we are
estableciendo
working with
pacientes y que son
1,000 patients,
voluntarios.
maybe 100 patients
La primera pregunta
working
es,
with volunteers.
¿podría darnos al
Could
menos
you
5
give us
métricas
at least
para que
5
este programa
metrics
de intro
so
level
that this intro
pueda
level
empezar
program can start to
a colectar datos y qué
collect
datos serían
data
esos?
and what
No
data
quería
should
utilizar
it collect
35
and not
porque
having to
sería
use
una
the
complejidad
35 like the
extrema.
oncology
Y la
academy
segunda es,
suggests. And the second
¿cómo
one is
podemos
how can we
proteger
protect
esta base de
this
datos si
database
la vamos a tener en
if
Excel?
we are going to have it in the spreadsheet? Thank you.
Okay, I'm not sure I understood the very last part of the question, but I'll answer the first part and then you can tell me. I think that quantifying barriers to care, really documenting what are the problems that people are experiencing that get in the way of cancer screening, cancer treatment, survivorship. I think that's really, really important because if we don't know what those challenges are, we can't address them. So I would say the two metrics that I would definitely capture are what are the barriers that the patient is experiencing and what are you doing about it? And so in terms of the other three, and those are also aligned with core metrics in the AONN toolkit. In terms of the other three, I would base those on the needs of your interest holders. So, what problem are you trying to solve? Are you trying to, do you have a low screening rate? If so, I would look at time to screening or number of people screened or number of uninsured people screened or in a certain demographic. If that's true, then you also need to capture that demographic. So if you're trying to increase screening in a particular region of Colombia, you would want to capture their location and measure, time to screening based on the location. So I think barriers and interventions to address barriers are super critical. I also think, workload of the navigator is helpful to capture so that you know how many people a person is assisting, how intensive that assistance is so that you can make new decisions. And in terms of our tool, our Excel-based PNBot tool, you can select a couple of measures. You can choose all of them, but you can deselect measures. And again, I'm not super technically savvy in this tool. A wonderful person that worked for me several years ago, Serena Phillips, was brilliantly designed this when I asked for certain metrics. And so, it's a starting point, but you can pare it down if you want. And I think also, particularly for programs that are just starting, in addition to barriers and interventions, capturing that story and from kind of what's behind those numbers, what's going on with the patient, why did your program make a difference, what did your program do that couldn't have happened if your program wasn't there, I think can be also very powerful. So I don't know if you asked.
Yeah, the second question was like, for example, if we are using Excel, si estamos usando hojas de Excel, ¿qué recomendaciones tenemos?
What recommendations do you have to protect the database, to protect the data? Of course, it's in a computer. Yeah.
Okay, so that's the main point. So I don't know what about the translation you're getting, but this is what it is.
All right. Yeah, I mean, this is a definite concern. So, I mean, our Excel-based tool, it's in Excel. It's not currently designed to interact with the EHR. So, I mean, your privacy and confidentiality considerations are basically similar to what you might do in a research study. You might want to keep it on a server that's behind a firewall. Only one person at a time can update that database. You want to make sure that it's not, in an application that could be, searched for online and accessed, right? You don't want to keep it on a live, non-protective kind of setting. So just those usual precautions of, making sure that you have the security in your firewall, you're storing it in a place where you would store research level or patient level data, but it's not in the patient database. So that's something I think each institution has to identify because it's very important, of course.
Thank you, Doctor. So I think we have chances for just one question. So otra pregunta que tengo
So
es
the
para
next
la doctora
question that I
Marina.
have is for
Marina, recuerdo
Dr.
que,
Marina. The next
cuando
question
estabas
is,
platicando de que al
Marina,
final,
I remember
después de
that
esas
when you were
23
talking that
aplicaciones
in
que
the
se
end,
estudiaron, al
when
final del
you
día solo 5
shortlisted to that
cumplieron,
big list
¿verdad?
of
Las
applications,
características que
eventually
estaban
only
buscando
5
este
met
grupo.
all the
Aquí la
requirements.
pregunta
So
que
here
tengo
the
es,
question that I have
vamos
is,
a hablar sobre un poco del costo.
let's talk about the
Que
cost.
dentro de este análisis que se
So
hizo
within this
también se trabajó el
analysis,
costo y si nos puedes
of
hablar
course,
un
you
poco
analyze
más
the cost. And
de
if you
cuáles
can
fueron
talk a little bit
algunas de las
more
barreras que se
about some
encontraron
of
en este
the
estudio
barriers that you found
desde el
on
costo
this
de
study
mantener una
about
base
the
de
cost
datos
of maintaining a
para,
database
vamos a decir, regiones como
for
Latinoamérica.
regions
Y cómo
like
esto
LATAM
puede
and how this
dificultar,
can have an impact
¿verdad? El que realmente
on the fact
organizaciones
that
de bajos
actually
recursos como
low income
varios
organizations such as the
hospitales
volunteers
públicos en
and also
especial
public hospitals in
puedan
particular
tener este
can
tipo
actually
de base de datos.
keep and maintain these type of databases. Thank you.
Sí, cómo no. Sí, hablando del costo,
Yes,
a
talking
ver, como
about
la
the
primera dificultad que
cost,
tuvimos es
like
que
the
los costos no
first
eran
issue that we
claros,
had is the
¿no? Ese
costs
es
were not
el
clear
primer
when we were
escalón.
evaluating. That was the first thing.
Uno en
Um,
general cuando implementa una
Usually,
solución
when you implement
tiene,
a solution, you have,
dependiendo como del nivel y
depending
de la
on
complejidad,
the
pero
level and the
las cosas más
complexity, but the most
profesionales tienen el costo
professional
de
things
licenciamiento.
have
Ahí en
licensing
general
costs.
sí está claro, porque hay una
In those
organización
cases, in general,
atrás
it's
que está
clear because there is
acostumbrada
an
a
organization
adjudicarse las
behind
cosas y a
that is
cobrar por el
used with
servicio que
by
presta,
pricing the
que
services
suele
that they
ser
provide.
claro. Esas eran
That's
las
usually
soluciones
clear.
por ahí
Those were
desarrolladas
the
por fuera
solutions developed
de los países de
outside
bajos y medianos
the
ingresos,
low
muy
and
vinculadas a
mid
diferentes clínicas, a
income
paquetes mucho
countries,
más
very
grandes,
well
pero que
connected
tienen un costo
to larger
importante
suits
de
in
implementación y que
electronic
nada más
records,
vale la
but
pena
the
si
implementation
uno
cost is higher,
optimiza el
and they
resto
are usually
del
worth if you
paquete que
use
viene con esa
the
historia
other elements of
clínica
that
y
the
todas las
suit that
cosas
comes with the
alrededor.
clinical records and
Solamente
all the things
para un
around that.
programa que
But just for
está,
a
digamos,
program that is
iniciando o que ya está consolidado
starting
de
and or
navegación,
that is
pero que yo no
consolidated, but
uso
it's
el
just
resto
navigation.
del software, no
But if
tiene
I
mucho
don't use
sentido
the remaining
pagar
software,
esa
it wouldn't make a lot
licencia.
of sense
Y
to
después
pay
por ahí
for
hay
those
soluciones más
licenses.
intermedias
And
que
then
por ahí
we
no
also
tienen
found
un
some
costo
like
tan caro de
intermediate solutions,
licencia, que se
but the licensing
ofrecen,
costs were
pero
not
después
that
tienen un
clear.
gran costo en
But
el
then they have a big
mantenimiento,
maintenance
digamos, que
costs.
yo tengo que
And
estar
even though
haciendo
I have
y
to
puede ser que haya como
I
esos
have to do,
costos
and
ocultos que después tengo
probably
que
there are
estar
some hidden costs that
pagándole
then I
a
have
quien
to keep
mantiene esa base de
paying
datos. Entonces es muy
the one that
importante,
maintains that database. So
nada,
it's very
preguntar
important
mucho
to
y
ask a
quedarse
lot of
como
questions
tranquilo en
and
que yo voy a tener un acuerdo si estoy trabajando
be very
con
clear
alguien
that
más
I'm going to have this agreement if
de
I'm going to be working with somebody else
a largo
uh,
plazo,
in the
y ahí
long
tiene que estar
term.
establecido cuál
And
es el costo de
there we
eso,
need to
de,
clearly
digamos,
establish what is the
alguien que
cost
si
of that.
falla algo,
Somebody that
tenga
in the case
respuesta
something fails, I can have a
para darme,
response.
y si tengo que cambiar
And
algo, porque
have
en
if
algún
I have to
momento tengo
change
que
something
tocar por
because
ahí esa base de datos,
probably
porque
at
ahora
some
quiero
moments I have
incluir
to
una
touch the
pregunta que antes
database
no
because
tenía o
now
un
I
parámetro
want
que
to
no
include
tenía,
an
el
additional question
costo
or
de
parameter.
pedirle a esa
The
persona de
cost of
desarrollo que haga esa
asking that
modificación
developer for that
esté desde,
modification
conversado desde el
should be
principio.
talked from
Y
the
por
very beginning.
último, recién cuando conversaban
Finally,
sobre
when
la
you were talking
privacidad y la
about
seguridad del
privacy
almacenamiento de
and
datos, solo un, no sé, quizás lo
security
conozcan,
of
pero yo
the
lo que
data,
utilizo mucho
what I use a lot for research in general for data security and what it meets with most of regulations of data protection, personal data protection is a software that is called RedCap, that is free. I think that it was developed by Vanderbilt University, if I am not wrong, and it's something that you download and you install on the server. That's why I need to have access to a server. But there's something, and this has a low cost, entry cost, but usually people that are in a hospital that have certain management, they can do the installation in that server of that database, and then maintenance is free, and it's like a form systems, like usually you're used to using a lot of forms, but that is a hosted first in that server, and is protected, and it also has the possibility to connect other forms. So I can trace that over time. Is well thought to do research with patients and follow up over time. I tell you about this because I think that is an interesting option to explore.
Muchas gracias.
Thank you
Ahora
very
no sé
much.
si Carmen Lucía todavía
I don't know
tiene
if
espacio
Carmen and
para-
Lucia, do we have a time for
Bueno,
another question or comment?
entonces,
Okay.
agradecemos a la
So,
doctora Mandi
thank you
Pratt-Chapman
very
por
much,
invitarnos
Dr.
a esta, excelente
Mandi
ponencia
and
sobre base de datos
Dr.
y,
Marina
damos continuidad
Rojo
al
for
programa. Muchas
these
gracias.
presentations. Thank you very much. And we continue. Thank you.
Gracias, Nancy. A
Thank you,
continuación
Nancy.
tenemos un
Next,
tema
we will talk
es
about a
muy
topic that I
importante, sobre
think
todo
that is
para
very
algunas
important,
personas que trabajan
especially for
en
some people who
investigación y son
work
las
in
experiencias
research,
de investigación y
and is
navegación de
the
pacientes.
research
Invitamos
experience
a la
in patient
licenciada
navigation.
Sharon Grenty.
So we invite
Ella
Sharon
es
Grenty.
editor-in-chief of the
She's
Journal
editor-in-chief of the
of
Journal of Navigation and
Survivorship
Survival
and Concord Academy of Oncology Nurse and Patient Navigators. Ella nos acompaña
She
desde
will
Estados
be
Unidos.
joining us from the United
Doctora,
States.
¿nos
Doctor,
escucha?
can you hear us?
Good morning.
Good morning. Doctora, por favor, nos puede decir para
Please,
hacer
can you
cambio de diapositiva.
tell us when we
Next
need to
slide.
change the slide?
Muchas
Please tell
gracias.
us next slide, okay?
Welcome.
Thank you.
Thank you for having me here today. I'd love for everyone just to take a moment and think about how you can make a difference in the lives of others by let's look at publishing your patient navigation outcomes. Can we go to the next slide, please? I call these pearls of wisdom. A lot of you call them objectives, but what you're doing today is you're collecting information, and over time, this will be put together in a treasure chest that you can use. We're going to talk a little bit about why it is important to publish your outcomes that you do every day. What can you publish? Where are places to publish? And this is not an all-inclusive list. It will be a list of places that publish a lot of navigation articles. Who can be part of these articles? You don't have to do it by yourself. And what if you don't have any scientific data or research? You definitely do have stories to tell, and you have ways that you do your work that can be shared among others. So let's look at the next slide, please. Why is it important to publish outcomes? And the very first one on this list is knowledge dissemination. If we kept everything to ourselves, everyone would struggle around us and repeat what we were doing. But what you do is when you publish, you put out a public, reliable record of research that you have. You share your new developments, your findings, and you share ideas with your broader professional community that may allow people to think, I can do this, or I can do it a little bit differently. And that's why we look at the second point. Someone can reproduce what you're doing and validate it even further, that it works. Or don't ever hesitate to share what did not work or why you had an inclusive result. This helps others look and say, oh, I don't want to go down that same path, but maybe I can look at going a different way. It allows them resources and experiments that didn't yield good outcomes, and that allows them to go and look at alternative approaches. The other reason is it fosters collaboration, innovation. When you publish something, you invite engagement from other people. This leads to new collaborations and the development of innovative solutions. You build on or you challenge other existing work. So why is it important to publish outcomes? Don't sit on what you're doing every day that's being a success. Next slide, please. From a personal standpoint, it is about you. It is about you to advance your career when you publish. It's a vital step that says, I have taken a professional step in growth. I'm serving as a demonstration of expertise in what I do every day, and I am capable of sharing with others what works and what does not work in my daily life and my daily work. Those of you that are trying to look for funding, a strong publication record can demonstrate the quality of work that you do, and it makes researchers more attractive to funders for grants and other support. You are making a difference in the healthcare world. And establishing credibility. It's evidence of a researcher's contributions, establishing their credibility and expertise within their field. You may, when someone looks at your work, that's the way sometimes we look at who can come to a conference and present. They publish something, so let's do that. And don't think all about research. Think about your personal stories too. They make a difference and often get people invited to attend to speak to conferences. Next slide, please. For society as a collective group, when we look back of navigation, it is just 2 decades old. For 2 decades, we've really already made a difference that we're the only evidence-based intervention to eliminate health disparities, and you improve health equity across the continuum. When you start a process, you may focus on an underserved group that needs a lot of help. But when you focus on that process, you can actually apply it to everyone that comes through your doors for healthcare or comes through your community clinic for healthcare. It makes a difference for society as a collective group. And just one example that I showed here was what we published in our Journal of Oncology Navigation Survivorship in 2022. We showed that by just using navigators, using the community, using your electronic medical record with real-time alerts, we took the health inequities down to almost zero on several populations we looked at. So you do make a difference out there, not only where you are locally, but when it's shared, it goes out nationally and internationally. Next slide, please. So what articles can you publish? It can be research. It can be a review article. You may be someone who works in women's health and you look a lot at what are the side effects that they're having from their cancer treatment. You could do a review article of things that are out there or a scoping article that brings things together. A case study is highly valuable. Have you learned something with a specific example that you know others are probably facing every day, whether it's access to care, whether it's the way treatment comes or whatever? Commentaries, please feel free when you see an article in a journal to comment and say, yes, I have seen that, or have you ever thought about another point of view that you can take forward? It's that interaction with colleagues that you can start about. You definitely can publish on your navigation techniques. We've heard a lot of them shared here today, and it's wonderful to hear about what's working and sometimes what's not working. You can talk about your history of navigation. We have published that in the United States, but it's also what's going on in your world, what's going on in your country. Where did your history of navigation start and where is it going? And what are some of the industry trends that we're seeing right now, especially with genetic testing, genomic testing? It's making a huge difference in the world of people that we care for every day. Your accessibility, who has good access and who doesn't? What is the industry saying about what you're doing on a daily basis? Next slide, please. This is not a conclusive list. Let me say this right up front. These are just places where you may want to publish. And what I did, I went through and saw who is publishing a lot about navigation. And you can see here with original research, would you ever thought about Cancer Epidemiology would have published on navigation? But they did. They come out with some of our first outcomes back in 2011. So yes, they looked at this. The Journal of Oncology Navigation Survivorship is all about what are you doing as a navigator. There's others that look, the British Medical Journal, things like that. When you look at review articles, often you see review articles in things like ASCO publications. Springer has several magazines that they can look at. Conquer is a patient-facing magazine, and let me say that's where a lot of people start their writing career. We focus on how do you talk to a patient. You do that every day. So this is where we often have navigators to start. Tell your story on what you do. Tell a specific case study. Or if you'd like to just do on what it means to be a navigator in the publishing world, what it means to be a navigator in the community. These are where these articles are greatly published. Case studies make a difference. We have something called CATCH, C-A-T-C-H, on the Academy of Oncology Nurse and Patient Navigators website. This has made a difference. This has made a difference every day. What we do is we take a catch and we look at one of the 35 standardized metrics around navigation. All it is stories that you do every day where you made a difference in a patient's life. And it's been stories where we've saved people from going to the emergency room. It's been stories where you thought they're not ready for that first visit because they don't have all the results or studies in yet. But catch has made a difference. And when people see these catch stories that have a measurement with them, it also supports of why we're getting reimbursed for patient navigation on a cost basis. So it makes a difference. Commentaries, you're the expert. You know what's going on in that world out there. Do you have a commentary you'd like to say, maybe about men's health? Do you have a commentary that you'd like to say, we don't agree with what prostate guidelines are out there. We feel like it should be this. There's many different commentaries that you can make around the work that you do every day. And especially on your navigation techniques. What are you doing that makes a difference that you'd like to share? And I can share a story with that where I come from a very community-based hospital. We were at a National Cancer Institute, but we looked at what one of the National Cancer Institutes did on navigation. They did a simple procedure that when someone come in from surgery and they talked to the surgeon about the surgical results, before they left that visit, they immediately had a visit with the medical oncologist to carry on their care. We put that same process in place that was at a National Cancer Institute in a community hospital. We drove down the time that it started for people to start their chemotherapy. And we know by driving down the time and they start their chemotherapy earlier, it makes a difference in survival. So it's a little thing that we did looking at a technique that worked somewhere else, but we applied it to where we were. History of navigation, you can look at books that are published on navigation. A lot of the industry that you work with, a lot of their newsletters don't know about their navigation. They don't know about navigation in your community or your country, and it's a great place to approach them and say, would you like me to write an article on the history of navigation in our area? And when we look at industry trends, we look at the health newsletter, the university newsletters, where some of you may work, or your professional organizations. Can you write something for a newsletter that makes a difference? Next slide, please. Who can be part of these articles? Everyone that's around navigation can be part of these articles. So if you don't have any scientific data or research, that's okay. Oncology nurse navigators, our oncology social workers, our oncology patient navigators, those are the three recognized professional levels of navigation. Community health workers, everyone can publish. You don't have to publish by yourself. It may be a group. It can be a simple start as an abstract that you put together to present at a conference. And when you present that at the conference, you've laid down your research. You said, we've got evidence-based practice out here that work. In your abstract, you may say what worked and what didn't work. The bottom line is this. The wealth of knowledge from researchers to those walking the walk, those are navigators that are working every day in the field, meeting patients face to face. You reflect what's going on in this navigation world. You contribute, you cover everything from clinical outcomes to program administration and health equity. That's the bottom line. You make a difference in the work that you do every day, and we want to hear your voice. What are you doing out there? Let us work with you to help to get this published. Next slide, please. These are my writing pearls I'd like to share with you. There is no single right way to write a piece. You focus on you generating what you know without getting bogged down by the editing. The goal is to get the words on the page. You can refine them later depending on where you're going to publish. You write with a passion. Whenever possible, you choose topics you're genuinely passionate about, that you work with every day. Your enthusiasm will translate into stronger, more compelling work. If you're going to write, you need to continue to read. Is there already information out there on what you're writing about? We need to stay current. So I'm a big promoter of reading to stay current on what's out there in the navigation world. And the process of writing is a journey. It's something of continuous improvement. It's not a sprint. You can't start writing today and have the article written tonight. Maybe you can. It would make a difference if you can write that fast, but sometimes you can't. Get your thoughts down on the paper, step away from it, come back to and continue writing. Next slide, please. I want to thank you for your time here. I will be around for questions later. So thank you for inviting me, and I look forward to seeing all of your name on a publication in the near future.
Muchas gracias, doctora Sharon, por su
Thanks so
excelente
much,
conferencia.
Dr. Sharon. We invite Claudia Abreu, professional risk assessment and expert in analysis teams of health situations. She comes from Cali, Colombia, from Pro Pacifico. Doctor, you have 15 minutes for your presentation.
Feliz mañana para todos. Un gusto
Good
estar con
morning
ustedes.
to everyone. I'm so cold. Oh my God, I am freezing.
Para iniciar entonces les
To
pongo en
start,
contexto.
let me give you context. Pro Pacific, we are a foundation
En Valle del Cauca,
that in
principalmente
the
en
Valle del
Colombia,
Cauca region, in the Colombian Pacific region, we strive through different articulation exercises, move forward in project to fill the gaps of styles. We are specifically in the field of health, and our strengths are chronic diseases such as cancer. In this context, with the health secretary of Cali, Valle, and Buenaventura, in a participative and collaborative exercise, we asked ourselves a question, and it's how is navigation right now in Valle del Cauca, and how can we take that first step to strengthen us? And so in this regard,
Gracias.
okay.
Entonces hicimos
So
un
we
ejercicio
did an exercise of co-creation, co-creative exercise, and this is how we usually work in Pro Pacifico, with a linking exercise of all the different organizations that accompanied us, the health secretaries of the region of Cali and Valle del Cauca. I went back, sorry. Buenaventura, out of the 10 insurance companies that we have, 7 accompanied us, and also different organizations specialized in cancer, of complementary area, and also IPSs, small insurance companies. So the question, what are the opportunities and challenges that navigation strategy has in our region?
Trazamos unos
So
ejes
we
que fueron las líneas de partida
drew some lines, starting lines that allowed us to head to the horizon where we wanted to go. And there we identified such axes, what are the barriers, what are the main opportunities that we have to work in oncological navigation, what are the essential practices that from oncological navigation we should execute, what aspects within oncological navigation are prioritary, or that we may identify as a priority for our region, and additionally, what we expect from such a process, how we expect to get to the port.
En
so,
estas preguntas que
from
se
these
fueron
questions
contestando
that
con la
we
participación de todos
answered
los
bit by
actores
bit with the participation of all the
logramos identificar diferentes
interested
¿Cuáles
parties,
son
we
las barreras
identified
más
several
frecuentes
barriers, the
en la
most
atención
frequent
oncológica en
barriers
Cali?
of
Y primero
oncological
logramos identificar
care
entonces el
in Cali
acceso a
and
la
attention.
información.
We
Em,
identified the access to
es
information.
un común
This is a common denominator
y
in
claramente
Colombia,
Cali
and
también tiene
clearly
esta tendencia.
Colombia, of
Tenemos una
course, Cali
fragmentación de
has
la
the same
atención que
tendency.
genera una
We have a
fragmentación de la
disjointed
información
attention
y
and
así
a
ese
fragmentation
ejercicio
of the
de
information,
navegación y
and the
acompañamiento
exercise of
pues se
navigation and
hace más
accompaniment
complejo.
becomes
Entonces,
tougher.
identificando esto,
So
es
identifying
súper
this,
importante que
it's
trasciende entonces
highly important and
desde
it
los
transcends
múltiples
from the
prestadores que
multiple
hacen la atención desde el diagnóstico,
care
desde
delivers
la tamización
that give
hasta el
screening
tratamiento.
or
Entonces,
diagnose
es
all the way
ponernos en
to the treatment. So
contexto
we need to
y identificar,
place ourselves within the
segundo,
context
entonces,
and
una barrera
identify,
administrativa, que tenemos
second, an
múltiples
administrative
prestadores y que
barrier
debemos,
that
para hacer un
we have
ejercicio de
as
navegación
suppliers
eficiente,
to be efficient in
identificar
our
esa red
navigation
prestadora
and
cómo asegurar.
identify that network
Adicionalmente, pues
that needs to be
barreras
assured. Additionally,
tecnológicas, barreras en el
technological
diagnóstico
barriers,
desde esta
technological in
fragmentación,
the diagnosis
es
from this
complejo
disjointment,
desde el
it's
desconocimiento de la
complex
población que
from
es objeto
the
de tamización,
ignorance
de acuerdo a
of
los
the
protocolos
population of
de los
screening.
cánceres tamizados,
For example, those
identificar esa población. Entonces,
screening
nos lleva
that applies to
a
several
ejercicios
cancers. It
anteriores que se
takes us
deben
to
realizar desde
prior
los
exercises that
aseguradores y
should be done from
prestadores
the
para
insurance
que lleguemos
companies
firmemente a
to
ese ejercicio de
arrive
navegación.
more firmly to
Adicionalmente,
these
pues las barreras
navigation exercise. Additionally,
organizacionales de la atención.
organizational
Eh,
barriers.
no tenemos
We
un pie de
don't
talento humano que
have
esté
human
capacitado,
talent that
formalmente
is
capacitado, que son muy
formally
pocos.
trained. It's
En el
very
Valle no tenemos
scarce.
escuelas
We don't
que
have
estén
schools
haciendo
in
el
Valle del
ejercicio de
Cauca that are
navegación
doing
aún. Y
the navigation
adicionalmente, pues como
exercise
les
and
decía,
teaching
la brecha
navigation yet, and what I was telling you about the gap
de cara a
in
las
the diagnostics.
oportunidades, entonces en este ejercicio
So, in the
logramos
face of
identificar
opportunities, we
que
identified
necesitamos dentro de
that
esas
we need
prácticas esenciales,
inside
pues
these essential
identificar esa
practices to
vocación de
identify
seguimiento,
the follow-up
esas habilidades
location,
blandas que hacen que
these soft
efectivamente
abilities that
un
make
navegador
that a
acompañe
navigator can
a su
effectively
paciente y a
accompany
su cuidador
his
en
or
este
her
ejercicio
patient
interno de
and also the
navegación.
caretaker,
No es
the
una
caregiver,
acción
sorry.
administrativa,
And it's
no
not
es
an
un
administrative
acompañamiento
action, it's
administrativo,
not an
es un
administrative accompaniment,
acompañamiento
it's
en la ruta,
an
es
accompaniment
llevar de la
uh,
mano al paciente y al
from within
cuidador
the route,
para que
from the
efectivamente
journey,
lleguemos a
walk
ese
the
buen
patient hand
puerto.
in hand
Entonces aquí
to
esas,
reach our
esas
final
habilidades
destination.
blandas
So
son
these soft
súper
abilities are
fundamentales,
crucial,
que el enfoque
that
de
the
capacitación de
focus
los
of the
navegadores
training of our
que
navigators
arranque
will
desde esa
start
premisa.
from these
Adicionalmente,
principle.
pues
And
necesitamos conocer
additionally,
las
we
rutas
need to know
oncológicas sí o
oncological
sí, y
routes.
adicionalmente cómo se dan en
This
la
is
región,
mandatory, and
eso es
how we
fundamental,
are to
y
apply
cómo
them
se dan de
within our
acuerdo a la
regions, and
contratación.
how
Y la
are we
contratación aquí es
to apply them
fundamental
from
porque
our
lo veíamos
context.
la semana
How are
pasada,
we
un
contracting
ejercicio
and
que estamos
hiring?
haciendo para cáncer de pulmón
Because we were doing an
y
exercise
cáncer
of
de ovario,
pulmonary cancer
que
and
el
ovary cancer,
paciente
that the
si está
patient,
asegurado con
if
una,
the patient
con
is
un EPS,
it's insured with an
que tiene una
EPS,
contratación que
which is
hace
a
que las
national
instituciones
insurance company
puedan
that
conversar entre ellos,
can
el
cross
paciente no tendría que
information
estar
with
con su
other entities. The
patología en el
patient
bolso,
could not,
llevándola hasta
wouldn't have to
al
carry his
laboratorio patológico.
pathology in his
Entonces
purse
aquí
all the
también
way to the lab.
pudimos contar con la participación de
So here we
aseguradores
could have the
que puedan
participation
evidenciar
of
la
insurers that
necesidad
can evidence the
de
need
estandarizar
for
unos
standardized
mínimos
some minimums
en las rutas
in
oncológicas
the
que
oncological
permitan que ese
routes
diagnóstico
for
fluya de
that
forma más
patient
eficiente
to
y que
flow
no
in a more
disminuyamos,
efficient
porque en
manner,
este
and
ejercicio,
that we
por
don't
ejemplo, cuando identificábamos esas situaciones
interfere
en
in
las
that exercise,
contrataciones,
because when
el
we identify
paciente
those situations in
tiene
the
que
contracts, the
llevar su
patient
patología. Y sí, lo
has to
podemos
carry its
acompañar desde la
pathology. And yes,
navegación,
we can
pero eso
accompany the
implica
patient from
para ellos
navigation,
unas
but that would
dinámicas
imply
que
for them
aumentan el
some
gasto de
dynamics that
bolsillo,
would
que pueden alterar la calidad
increase
de la
the
patología y por
out-of-pocket
tanto
expense,
retrasos
increase
y
the
demoras en
pathology,
el
and therefore
diagnóstico.
delays in
Entonces
the
es un
diagnosis.
ejercicio
So it's an exercise
que
that
debe ser
needs to be
general y que nos permite
general,
entonces
and that
una
allows us then
visual general de
a
cómo se
general
da
visual
la
of
atención
how
oncológica.
the oncological service
Adicionalmente,
is.
entonces, pues esto
So in
implica
addition
que
to
el
that, that
navegador
implies that the navigator
conozca cómo
recognizes
se da esa
so how
práctica
that
en
practice
la
happens
contratación.
in
Y
the
también
contracts.
otra situación que ocurre es que
And another
cambiamos
situation is that we
fácilmente de
easily
red prestadora.
change
Como
the
tenemos la población de
provider
laboratorio,
network. You know,
seguramente van a
today, today, for example, they are working with a lab and tomorrow different providers. So we need to have contingency plans to be able to provide effective support hand in hand with the insurer, hand in hand with the new provider, with the last one to hand over the patients also. So it's a logistics and preparation exercise that requires support and sensibility of the navigator in face of all these administrative situations that they need to join the patient. And clearly the resolution of all these situations. Within the exercise, we identified different categories of the variables that should be recognized and managed. And within those categories, first, without a doubt, the communication, the coordination of service, and this makes reference to how we are going to work, how we are going to recognize those administrative and contract dynamics in order to support the patient, and in that sense, getting to know a simple thing that we do in one of the projects that we are leading in breast cancer is the coordination mechanism, and something as simple as having the email and the phone number of the navigator in the other organization reduce the times. The thing is that we don't sit down, we don't recognize each other, that the providers, a lot of times they don't are not familiar with actually the network of providers, and the provider, they don't know who manages the cases in the insurers. And so it's a simple thing that we just simple conversation that would reduce the diagnostic times, because indeed the information can reach the one that can manage that. That exercise has helped us a lot in case management for biopsies of breast cancer diagnostics. Initially, the training and strengthening that capacity of the route, the training about that, about how it works, training staff, getting to know the journey, the healthcare system in the recognition of all those barriers that we already see. So how can we support the process and how we can approach those administrative barriers that may happen, and technology in information systems. This is an important situation, and because each vendor, we're going to see that each institution and its insurer has a different information system. So the information systems don't talk to each other, and we don't talk as officers. So we as officers, the navigator needs to overcome really large barriers. So in this exercise, then we did the mapping of organizations, and we were able to accompany them to support what's the process in the organization. This was an exercise of putting our hand in the bottom of our hearts to tell how do we do it without a cognitive interest, but in the honesty, how does that happen to be able to strengthen and improve that? So we were able to find that there are organizations that have um, staff that is fully dedicated to navigation, trained staff, and also they train their teams so that navigation is effective. There are other organizations that their staff, in addition to navigating, they would be in charge of the sexual and reproductive health, taking the PPH, etc. So clearly, the effectiveness of this exercise goes down, and there is now a continuity in the exercise. We accompanied, and it was 23 organizations that we identified in budget, and we surveyed on them to recognize those dynamics. As I said, in training and education is a large opportunity for improvement. We have important professional strength, but the big number of our navigators don't have that like background. You know, they are trained along the process of of being in the project. So that, but we need to formalize that training because they are not actually trained. And in data information systems and management, we have an important improvement because each organization has a different information system if they do. If they otherwise, it's managed from an Excel, and it can be Excel spreadsheet, and it's manual, and sometimes the databases get lost because when we have high staff turnover, so you have one spreadsheet in Excel, and then the new person might not find that spreadsheet, so they will need to maybe make a new one. So that information management, sometimes causes loss of information. And we need, if we have an information system, that information system should actually talk to the provider network or the articulating network they are part of, and of course with the insurer. This was one of the findings in phase of the data management, and in addition to that, the audits are manual, so we don't have like a tracking, a way to track that information. In face of the reference and counter-reference exercise, the team of navigators here has an important challenge, and is that in our reality, it's like the authorization, and the authorization depends on the insurer, the way that the contract works. Mediating that authorization can take half a day, but for some others, 8 days to get the result of that pathology. So here, the dynamic is extremely important, because we need to align ourselves in the management times of those authorizations. And here, the navigator is absolutely a key, because it supports, helps, and aids in identifying the one that manages those authorizations in the insurer, so that we can have an answer response in the shorter time. So that's a key, so that we could standardize from the insurer those management times. In the practical exercise, we see the times in some types of cancer, it has gone down, for example, for breast cancer. Yeah. However, we have other cancers that we need to keep working on. And as I said, in face of the indicators and quality assessment, we don't have a standardized indicators. So there we have the need to improve the quality of information. This is a big challenge in face of the healthcare, but especially oncology, in spite of the fact that we might have different, for example, the high cost account, the quality of information is actually an opportunity to work in this exercise of navigation. And within those barriers and needs identified, we have the lack of budget, human resources, high staff turnaround, and the knowledge in the information systems. This is key. Delay in the diagnostic test, as this is key. And we have seen how navigators are actually tracers in this, and difficulties in these references. Within this survey and this support that we provided to the organizations, we were able to identify out of those 23, 52% are private, 47% public IPSs, 47% they were in Cali, distributed in Cali, so the others, we had 4 in Jumbo, 2 in Tula, and the others one by one. This one. As a area of follow-up to risk management for patients with suspicions, 22 were referred that they had a follow-up area actually. And in addition, there has been a training. 17 of them answered that they had held indeed a training, and about the questions whether they had implemented navigation strategies. So here we said the percentage said yes. So from screening, so we see that the minimum, in minimum cases, sometimes they have 4 with a maximum or high, sorry, an average of 500, in media of 80, and a mode of 40. So, and IPSs of a high complexity, specialists in oncology. Excuse me, I just went back to the beginning, sorry. Okay. When we asked the question in terms of how long in average in time of management is dedicated to patient accompaniment, 13% part-time, 30% full-time, hourly 30%, and the remaining didn't have information about the time. So 43% is part-time for this accompaniment, and hence the need, and this was part of what we worked in this exercise, the need for this staff to be exclusive so that they are efficient, understanding the dynamics and the magnitude of those barriers that we have. Information systems, the authorization can take long, So if we take out the time to the navigator, of course, it won't be efficient and we are not impacting on what we should. How many patients in average with cancer diagnosis attend to your center per year? 69% from 0 to 500, 4.35, 500 to 1,000, and 17% more than 3,000. What happened? With me?
Estoy haciendo todos los daños yo con esto.
Okay, excuse me. Okay, okay.
Bueno, de cara a cómo cree que se debe estandarizar,
Well, in terms of how do you think that we should standardize the barrier management in the patient navigation? So access and standardization, we require a checklist so that we can identify what are the patients that effectively are from the city or that need different attention because they don't correspond, they don't live in the city. Cali is a passing point when you're going to the Colombian Pacific. So we get population from different parts. We have reference centers in oncological response, and then we have population from Cauca, Chocó, Nariño. So it's important to make that difference. And from there, the authorization of the services and those appointments to be fast. Additionally, to identify those barriers related to the patient, if they are economic, and how from the support of different disciplines, social work and psychology, we can approach and accompany those, manage those barriers. In face of the opportunity to speed up the treatment, as I said, articulation with the insurers, that coordination mechanisms that we are working on, and this has been key in that exercise that we have been carrying out for breast cancer, uh, regarding the acknowledgement of how important navigation is and how it has an impact on the number of women identified as diagnosed. And here we were able to identify that mechanism of coordination and that recognition between the person that identifies the case and the ones that are going to be managing in the IPSS is key because we have a cross-cutting tool that is for everybody. So all of us, we can identify the case, we can reconcile the information, overcoming one of the barriers. In terms of the navigation model, identifying the barriers that affect the user, articulating effectively the oncological providers of the network, and implementing a single reporting forum for all the insurers so that they can identify those patients, the barriers, the categorization of those barriers that each one of those patients face. And within support and accompaniment and follow-up, allocating a person that is familiar and with the process, and here assigning like a champion that supports or accompanies the patient and the support network. Regarding the benefits, this program provides understanding all the implications, all the barriers, and everything that we saw. What are the benefits of the navigation system? First, supporting the patient so that they come have better outcomes, probably saving lives, reducing delays in service and response, and this has to do with those administrative dynamics in face of the petitions, complaints, requests, and it's a petition where we can have a clear impact if we are supporting the patient, if patient doesn't feel alone, if we are telling them how do we need to move along this. Of course, clearly this will have an impact on this indicator. In screening, depending on life cycle, especially for screenable cancer, of course, and in the recognition of population that needs to be subject of those screening, that is within the promotion and maintenance journey, the promotions according to the intervention flows and inclusion in the network, and in the comprehensive patient management, continued support from the detection and this navigation exercise that was also quite recurrent and emphatic as a team in this exercise that we are doing for lung and over cancer. It needs to come from the screening system. The accompaniment needs to be from the entire process. First, for recognition, and second, so that we can effectively address all those points that generate barriers in the service. Complete information and traceability in order to identify the patient, generate
una auxiliar con la que tuvimos el enfocar la semana pasada, que seamos como amigos.
that we should
Y
be
es parte de eso,
friends,
¿cierto?
and it's that fantasy,
Tener
having
y que el
this
paciente se sienta
closeness,
cercano
and for the
a
patient
su
to feel
navegador.
close to
Y
its
cómo
navigator.
hacer eso, pues no les toca
How will
luego
this
estar
be
rotando
done?
la
They don't have
y la
to keep
valoración de
rotating the navigator, and it should be
y la
done
calidad
by
de la
type of
atención
cancer
puesta
and the
siempre.
quality of the attention, that it's a
De
continuous
cara a la
attention.
reducción, a la
In the
reducción
face
de
of the barriers
ya vimos cuáles son las
reduction,
barreras
we've
que puede
seen
presentar
what
el paciente,
these barriers are, that
podemos hacer las
we can
opciones de
accompany, we
varios
can.
ejercicios que hemos
There are
identificado
several
de cara al
exercises that
miedo,
we've
por
identified
ejemplo, barreras económicas,
regarding fear, for
que desde la
example,
gestión
financial barriers,
del navegador,
that
incluso
from
la
the
Secretaría de
navigator,
Salud
more
ha
so
tenido
the health
identificado
secretary, we've
gestiones
managed to
recursos
identify
para que la
and
usuaria pueda
manage
llegar a
resources
su prueba diagnóstica.
for the
Entonces,
person to
¿quién lo
arrive
hace?
to the
El
test.
navegador. Un
So
navegador
who's to do this?
sensitizado.
Sensitized
Optimización de
navigator.
costos, sostenibilidad y
Cost,
administración del riesgo
efficiency,
de cara
administration
a
of
beneficiar
risk
a la
in the face
organización y
of
la
benefiting the
eficiencia
organization, and the
de
efficiency
los costos que se ve
of the
reflejada
cost that
claramente
is
en los indicadores.
reflected clearly in
Mayor
the
confianza,
attention
credibilidad,
indicators.
sobre
More
todo,
trust and
mejorar
credibility,
los indicadores de
improve
calidad de vida
the
y mortalidad
indicators of
costo,
quality,
y
of
esa
high cost
responsabilidad
quality,
social que
and the
como
social
organizaciones
responsible that as
claramente en salud
organizations,
nos tenemos que
health
hacer.
organizations, we have with
Aquí
our
unos
patients.
del
Here,
resultado
a
final. Con
few
todo
pictures
esto,
of the final
entonces,
results.
con todas estas
With
organizaciones,
all these
se desarrolló
organizations,
un documento
we
que es el documento de
designed
estandarización
a standardized
de buenas prácticas
document
y
of good practices
recomendaciones
and
para navegadores de
recommendations
pacientes
for
oncológicos. Es un
oncological patients
documento que está
navigators.
en la
This
página
is
de
a document that
ProPacífico
is
que
in
lo pueden
ProPacifico
consultar.
website
Esperamos
that
su
is
consulta,
open
denle
for
feedback a nosotros
consultation.
y
We
opiniones.
expect you to consult it and give us feedback. And we gave these documents to the health secretary of the city, of the department, and of Buenaventura. Additionally, checklists that we did also with these organizations, we finished the list, we delivered it, and the publication of the document, the dissemination of all parts. This is a document that was socialized to the organizations and the health secretaries. In this moment, within their audits and assistances are asking for the teams within the organizations, and they accompany the making this visible and socializing these document. So we built this document of standardizing strategies of oncological navigation and a checklist. These are 3 documents that are available in ProPacifico website if you want to go there. And we wrap it up like this with this project. It's fundamental for us. These tools are fundamental for us, and these manuals are fundamental in different projects and different types of cancer, but always keeping in mind that for navigation oncological attention, navigation is a facilitator for the organizations, but most of all for our patients.
Agradecemos a la doctora
We
Abreu.
thank Dr. Abreu. We invite Dr. Marievelisse Soto. She's remotely logged in from Puerto Rico. Doctor, can you hear us?
Saludos, muy buenos días. Les escucho. Ustedes
Good
me
morning.
escuchan
I can
bien.
hear
Me
you loud and
preguntaron.
clear. And you see me? Welcome, doctor. She is an assistant research officer for the Centro Comprensivo de Cáncer, Puerto Rico University in San Juan. Doctor, you are to share your presentation, right? You please, you have 15 minutes for your
Gracias, pues, muy
presentation.
buenos días a todos.
Thanks so much
Para
to
mí es
everyone.
un placer
It's a
estar
pleasure for me
participando
to
en
be here,
este segundo
being a
congreso
part of this
sobre
second
navegación de
Congress
pacientes.
of
Y les voy a
patient
estar
navigation.
compartiendo resultados de uno de nuestros estudios de
And I will
investigación
be sharing results of our
he titulado
research. I've titled this presentation as
Determining
Determinants of Navigation Needs in Cancer Care in Puerto Rico, Findings from START PR study. I'd like to indicate that I have no conflict of interest. I'd like to start with this slide pointing that cancer disparities are rarely caused by a single factor. Instead, they arise from the interaction of multiple social determinants such as socioeconomic status, race, ethnicity, geographic location, gender, and migration status, as among others. So intersectionality acknowledges that these overlapping factors create unique and often more severe barriers to care, and that the navigation services for patients may help to overcome such barriers. To set the context, cancer in Puerto Rico, I'd like to give you some figures. According stats from the year 2018 to 2022, from our institute, approximately 40% of people in Puerto Rico were at risk of receiving a diagnosis in their lifetime. In the year 2022, Puerto Rico reported 16,500 new cancer cases and 5,000 deaths from this disease. And for January the 1st, 2022, around 4.5% of the Puerto Rican population, approximately 144,000 people, were living with some type of cancer. This pointing the important load of cancer that we have in my country. For you to know a little bit about the distribution of such cases, during this period of years, the most diagnosed cases varied from female and male population, as is the case in other places in the world. In the males, the most common cases were prostate, colon and rectum, lung and bronchus. In the case of female, the main diagnosed cancers were breast, colon and rectum, corpus, and uterus. We also observe a significant raise in several incidence charts for the period of 2022. In men, we observe a raise of prostate cancer and leukemia, pancreas, and kidney. This has risen in 4% average. In the case of female, we had breast, uterus, lymphoma, pancreas, and ovaries. Similarly, for the period of 2018 to 2022, the main causes for death by cancer were, amongst men, prostate, colon and rectum, lung and bronchus, and female, breast, colon and rectum, lung and bronchus. The most important that I want to point with this slide, if you observe the average annual percent change, is that the mortality tables for every case are diminishing in both cases. For example, mortality of prostate cancer decreased 1 point, and breast cancer decreased 1.3% annually. So these rates are going down in Puerto Rico, which proves that our strategies of control are paying results. In terms of cancer care in Puerto Rico, we face big challenges, and though we've reported some advances, some improvements, and I wanted to bring these two important studies that outline our key achievements in cancer treatment in Puerto Rico. For example, studies have reported that our cancer patients face practical unattended needs, and that's transportation, treatment affordability, and lack of resources. They also face challenges related to the lack of social support, the problems with transportation, and also a limited coordination regarding the care. In the face of the navigation program for patients in Puerto Rico, they are limited For
Nosotros en el
example,
Hospital del Centro
we
Comprensivo de Cáncer y
in
otros
our hospital,
hospitales
in other
en Puerto
hospitals
Rico
in
se
Puerto
ofrecen
Rico,
servicios de navegación
we offer
de pacientes,
navigation
particularmente para
patient
lo que es relacionado al
services for
diagnóstico, el
patients
tratamiento y apoyo social.
related to
Sin embargo, la
diagnose
Sociedad
social
Americana
support.
contra el Cáncer,
However,
capítulo de
American
Puerto
Cancer
Rico, es
Society
el único
in the Puerto Rico
programa
Challenge is the only
no
program
hospitalario que
mm,
brinda
that
servicios de navegación de
delivers
pacientes a todos
navigation
los
programs
pacientes
to all the
inscritos en su
patients
programa y esto a
that
través de todo
are
el país,
signed
incluyendo
in
Puerto
their
Rico. Quiero
programs. This
resaltar
is very
que
important
al
that I
momento,
want to
en lo
point
que
that
llevamos
at
de
this
año en el
moment, from what
2025,
we've
la Sociedad Americana contra el
had
Cáncer
of
ha
this year, American
beneficiado
Cancer
a
Society has benefited
655 pacientes y ha
655
ofrecido
patients and has
1.637
offered
servicios. Y otro dato
1,637
muy
services.
importante que es,
Another very
aunque
important
desde enero del
information is that from
2024,
January
CMS
2024,
cubre la navegación para
CMS is
beneficiarios
taking
del
care of the
Medicare en Puerto
navigation for
Rico.
beneficiaries,
Todavía
and
nosotros no
we
tenemos este
still don't
servicio
have Medicare service
cubierto
in Puerto
¿verdad?
Rico
Localmente por este plan médico,
locally
así que
by this medical plan.
coloca a los
So it
pacientes de
places,
cáncer en
it
Puerto
puts
Rico en
cancer
desventaja en
patients in
comparación con otros pacientes que
disadvantaged
tienen
in
el
comparison to
diagnóstico en los Estados
other
Unidos y otros
patients in
territorios.
other places of the
Así
United
que, aunque
States.
nosotros sabemos que la
So
navegación de
even though
base
we
nos
know
puede
that
ayudar a superar
navigation can
barreras de
help overcome
cuidado,
barriers
se
of
desconoce
care,
cuántos sobrevivientes de
we
cáncer en Puerto
don't
Rico
know
reciben este
how
tipo de
many
servicio.
patients
Así
receive
que uno de
these
los
services.
objetivos
So
del
one of the main
estudio que yo les
objectives
voy a
of
estar
the study that
presentando
I will be
fue
presenting
identificar la
was to
necesidad de los
identify
servicios de
the
navegación de
necessity of PN
pacientes y
services and to
determinar la
determine
asociación
the
entre las
association
necesidades de
between the
estos
need
servicios
for
y los
these
factores
services and
sociodemográficos y factores
social
relacionados
demographic
con la
and
salud
health related
entre
factors
pacientes
among
de
cancer
cáncer en
patients
Puerto
in Puerto
Rico,
Rico
utilizando
using
los
data from
datos
START
del estudio
PR.
START-PR. Quiero resaltar que este
I would like to
estudio
point that
evalúa
this
por
study
primera vez en Puerto
evaluated
Rico cómo los
for the first time in
determinantes
Puerto
sociales de la
Rico
salud afectan el acceso a la
how
atención del cáncer a lo largo del
these
continuo de
uh,
atención oncológica,
conditions
particularmente en
difficult
las
the
fases de
access to the attention,
diagnóstico,
particularly in the
tratamiento y
diagnose,
calidad de vida
treatment,
de los
and
sobrevivientes de
quality of
cáncer en
life
Puerto
of
Rico.
cancer survivors in Puerto
Un poco en
Rico.
términos de los métodos
A little bit in terms of the
que se
methods
utilizaron en
that
este
were
estudio,
used in this study.
quiero resaltar
I
que a
like to
través de
point that
múltiples estrategias
through
de
multiple
reclutamiento
strategy of
logramos
recruitment,
reclutar
we managed to recruit
871 participantes
871
quienes
participants
completaron una encuesta
that
en línea de forma anónima y
filled
confidencial
an
utilizando
anonymous
la
survey
aplicación web de Recta.
using web
Para ser
direct
elegible para el estudio, el
application. To
participante
be eligible for
tenía que
this
tener
study, the
21
participant
años o
needed to
más,
be
ser
21
residente
years
de
or
Puerto
older,
Rico y
be
haber recibido
a
tratamiento para
Puerto
el
Rico
cáncer en los
resident,
últimos
haven't
12 meses
received
y
a
completar
cancer
un
treatment in the last
cuestionario que
year,
incluye
and
preguntas
also fill
relacionadas
a
con el perfil
questionnaire
demográfico,
answering questions
el
about
perfil
demo,
clínico y social, preguntas
clinical,
relacionadas a
social
toxicidad
profile,
financiera, calidad de
financial
vida,
toxicity
servicios de
questions,
navegación de
life
pacientes
quality,
y calidad de
navigation
sueño.
questions, and
Aquí les
also
quiero presentar
sleep
algunos
questions.
resultados
I like to also
importantes del
present
perfil
important
social,
results about the
clínico y
social,
demográfico de los
clinical, and behavioral
sobrevivientes de cáncer
profile
en Puerto
of the
Rico.
cancer survivors
En
in
cuanto
Puerto
al perfil
Rico
demográfico de nuestros
regarding demo
participantes, la
profile
edad
of
promedio
our
fue de
participants.
60
The
años,
mean age
el
was 60,
70% son mujeres
70%
y
are
solo el
females, and
29%
only
de nuestros
29%
participantes
of our
reportó estar
participants
empleado.
reported
En cuanto al
to have
perfil
a job.
clínico, 33% reportó
Clinical
tener
data,
más de un diagnóstico
33%
de cáncer
reported more
y
than
el
one cancer diagnosis,
47% reportó tener dos
45%
o más
reported two or
comorbilidades, lo
more
cual podría complicar
comorbidities,
el manejo
which could
clínico y
complicate
afectar la
the
calidad de vida de los
clinical
pacientes.
handling and affect their
Sabemos que los
quality of
servicios de
life.
navegación
We
de
know that
pacientes, ¿verdad?
navigation
Ofrecen
services that
apoyo
patients offer
personalizado y
personalized
orientación tanto a los
support and
pacientes como
orientation
a sus
to the
familias para
patients
ayudarles
and
a
the families
sobrepasar
to
las
help them
barreras y
overcome
que
the
entonces se
barriers
pueda acceder a los
and that
servicios de forma
they may
oportuna.
access
Sin
the
embargo,
services in
solo el
time. However,
29% de
only
nuestros
29%
participantes
of our
reportó
participants
haber
reported
recibido estos
having received
servicios.
these services.
Además, una tercera
Besides,
parte de nuestros
third part of
participantes
our
indicó haber
participants
enfrentado
indicated
al
having
menos
faced
una
at
barrera
least
para
one barrier
iniciar
to
y
initiate
o
or
continuar el
continue their
tratamiento contra el
treatment
cáncer.
against cancer.
En términos de las
In terms
barreras
of
que estos
barriers that
participantes
these survivors
reportaron para
who reported
iniciar
at least
y o
uh,
continuar el tratamiento
to,
de
who
cáncer,
reported
nosotros
to
las
start or
clasificamos en
continue their
diferentes
treatment, we
niveles
classify
o
them in
categorías de
different
influencia
categories
en lo que es
of
la
influence
atención
or levels
oncológica.
regarding
Y destacamos
oncological
que el tipo de
care.
barrera reportada
We
con mayor
said
frecuencia
that
fue a nivel del
the
individuo, por
type
el
of barrier was reported
65%,
on an
siendo
individual
las más
patient with
comunes,
65%
lo que es
being
barreras relacionadas
most common
plan médico,
varies
los problemas
regarding the
financieros y
medical
la
plan,
falta de
financial
transportación.
problems, and
Además, se
transportation
identificaron
problems.
barreras
Besides,
importantes
we
a
also
nivel de la
identified important barriers
organización
on the
o de la
level of
práctica
organization
clínica,
or the
reportadas por
clinical
el
practice,
29%
reported
de los
by
participantes.
29% of
Y
the
por
participants.
último, en un
And last,
25% de los
and
participantes
25%
reportó
of the
barreras a nivel
participants
de
reported
proveedor,
lack of
siendo la
communication.
falta de comunicación con los proveedores la
This
más
was a
frecuentemente
biggest
reportada
problem, the
dentro de esta
communication with the
categoría.
providers
En cuanto a los servicios de navegación de
regarding the
pacientes, un
service of
22% de
navigation
los
for patients. So
participantes
22% of the participants
reportó que necesitó
reported
los
uh,
servicios de navegación de
that they
pacientes, sin embargo, no los
didn't
recibió, ¿verdad? O
receive
no los
patient
tenía
navigation services, or
disponibles
they were not
en el
available
lugar donde este
in the
paciente
place where they
frecuentaba
were being
recibir
treated.
sus servicios de tratamiento. En términos del
In
tipo
terms
de
of
servicios
the
de navegación de
type of
pacientes,
patient navigation
eh,
services
que ellos
that
reportaron como
these
haberlos
patients reported
necesitado
as
recibir,
having
indicaron que los más
that they needed and
frecuentes
didn't get them,
fueron
the
recursos
most frequent were
educativos por un
educational
42%,
resources,
seguido de la
42%,
coordinación de
followed of
servicios de
the
salud con un
health services
40%
coordination with
y
40.2%,
ayuda
and
para coordinar
coordination
pruebas,
for tests and
procedimientos y
aid for
tratamientos con un
procedures and or treatments
35%.
with almost
Cuando
35%.
nosotros evaluamos los
Well,
factores
and we
asociados
evaluate
con la
the associated
necesidad de
values
servicios
with
de,
the
de
necessity
navegación de
of
pacientes, nosotros
patient
encontramos que
navigate
solamente
patient
la
navigating
edad
services.
y
We
el estado
find that
civil se
only the
asociaron de
age
forma
and the
significativa
civil state were associated
¿verdad? Con la
significantly
necesidad de recibir el servicio luego de
mm,
ajustar por otras
uh,
variables.
with the
Sin
ability
embargo,
of
quiero
receiving the
resaltar que
service.
otras
I
variables
want to
importantes que, aunque no tuvieron
point that
significancia
other important
estadística, están en
variables
la dirección
are in the
esperada
direction
en términos de necesitar los
expected
servicios. Son
regarding
aquellos pacientes
the need for
que
the
tienen plan
services.
médico
These are
plan
these
médico
patients
público,
that have
pacientes que
private
reportaron tener
insurance,
Medicare o tener
and
una cubierta
well, they
dual
had
entre Medicare
other
y
types of
Medicaid.
coverage between
Y
Medicare and
también aquellos
Medicaid,
pacientes
and
que
also
reportaron
those
tener
patients that
dos o más
reported two or
comorbilidades.
more
En
comorbidities.
resumen, nuestros hallazgos indican
In
que más
summary,
de un tercio
our
de los
findings
pacientes de
indicate that
cáncer
more than a
en
third of
Puerto Rico
survivors
experimentaron al
experience at
menos
least
una
one
barrera para
barrier
iniciar o continuar su
initiating or
tratamiento.
continuing their
Las
treatment.
barreras más
The
comunes
most common barriers
fueron aquellas
categorized by
relacionadas al plan
multi-level
médico, la
influence
ausencia
across
de
the
pruebas
cancer are
confirmatorias, la falta de
individual
comunicación
patient,
y la
lack of
falta de apoyo social.
communication,
En
lack
Puerto
of
Rico,
social
alrededor de
support,
un
absence of confirmatory
22% de los
tests.
sobrevivientes de
About
cáncer
22%
necesitaban,
of
pero no
these
recibieron los
survivors
servicios de navegación
needed
de
PR
pacientes
services
y
but didn't get them, and
aproximadamente
approximately
70%
70%
no
of
había
cancer
recibido los
survivors
servicios.
never received
Los
these
tres servicios
services.
más
The top
requeridos,
three patient
¿verdad?
navigation
Reportados
services
por
needed
nuestros
were
participantes
and
fueron los
reported by our
recursos
participants were
educativos y la
education
coordinación de
resources,
servicios y la
coordination of
coordinación
health services,
para pruebas,
coordination for
procedimientos
test
u otros
procedures and
tratamientos.
treatments.
Eh, Estos resultados
These
nos llevan a
results
nosotros poder
take
hacer
us
unas
to
recomendaciones, ¿verdad? Basadas
make
en esta
some
evidencia que hemos
recommendations based on the
reportado.
evidence that we
Y una de las
just
cosas más
reported. And
importantes
one
es
of the
que
most important things
definitivamente en
that
Puerto Rico
definitely
existe una
we have
necesidad
in Puerto
de
Rico are
aumentar la concienciación sobre los
big
beneficios de lo que son los
need
programas de servicios de
to
navegación de
report about the
pacientes.
benefits of navigation
También
programs.
nosotros
And we
recomendamos
need also
incrementar
recommend to
el
increase
porcentaje de
the
pacientes
percent of patients
inscritos
enrolled
en
in
programas de servicios de
PN
navegación de
programs that
pacientes que
assist
los
them with
apoyen
services
con barreras y servicios
with
para
various
diagnóstico,
of timely
tratamiento y recuperación
diagnosis,
de forma
treatment,
oportuna.
and
Pero
recovery.
para esto
But
nosotros
for
necesitamos
this,
ampliar
we need to
la capacidad de la
broaden
fuerza laboral
the
e
workforce
integrar los
capacity,
servicios de
expand it,
navegación de
integrate
pacientes en lo que es
PN
la
into
atención
standard
oncológica
oncology
estándar.
care
También se
standard.
recomienda implementar
We also
servicios
recommend to
de los
implement
sistemas de referidos para navegación
PN
de
referral
pacientes
systems for
en las
patient
clínicas que
navigation
ofrecen
in
servicios
our
de tratamiento y
centers,
diagnóstico
clinics,
para
and
pacientes de
hospitals
cáncer.
that offer
Y
services for of
una de las cosas más
diagnostics
importantes para
and
nuestro
cancer
grupo
treatment. And
de
a very important
investigación
part
es que
for
las partes
us,
interesadas en Puerto
from our
Rico, los
research point of view, is
stakeholders
that
en
the
inglés,
stakeholders in Puerto
necesitan
Rico
abogar por
should
incluir estos
advocate
servicios
for the
como un
inclusion
beneficio reembolsable bajo lo que
benefits
es el
that
Medicare.
can be
¿Y por qué?
reimbursed
Porque esto es lo
under
que le va a permitir
Medicare.
a las
Why? Because this will
organizaciones,
allow
a las
organizations
clínicas
and
poder
clinics and hospitals
recobrar
to
económicamente por ofrecer este
recover
tipo de
themselves
servicio.
economically and be paid
Quiero culminar
for offering these services. I'd like
agradeciendo a las
to
entidades
end
financiadoras
acknowledging our
financiado parcialmente por Bristol Myers
funding
Squibb.
partners.
También recibimos fondos parciales
This
por el Centro
we
Comprehensivo de
we
Cáncer.
received
Y
photos
con
by
este
the
proyecto pues tuvimos la
Comprehensive
bendición de poder
Cancer Center. We
reclutar
share the vision of being able to
múltiples
recruit participants
escenarios
in
clínicos en Puerto
different
Rico, como
clinical
lo es el Centro
scenarios in
Comprensivo de
Puerto
Cáncer,
Rico,
el Hospital
and such as
Oncológico Isaac
the
González
oncological
Martínez,
Isaac Gonzalez
entre
Hospital,
otros
amongst
entidades.
many
Y
others.
también pues quiero resaltar
And
que
I'd
este
like to
proyecto de
also
investigación se
point
llevó
that
a
this
cabo,
research
¿verdad? O
was
fue posible
possible
gracias al
thanks
trabajo
to the
voluntario de
work
muchísimos
of
estudiantes en diferentes
volunteers,
niveles, ya
students
sean
in different
estudiantes de
levels,
bachillerato, estudiantes
high school
que
level,
estaban en
on a
su
high
gap
school
year,
level,
o como
students that
llamamos
were
acá los
in the
postdocs,
gap
estudiantes de maestría,
year,
que dieron de su tiempo para reclutar,
graduate
promocionar el
students that
proyecto
they
y
promoted
también
our
para
project. They helped
analizar los
us
datos de nuestro
to analyze
proyecto.
also the
Por
data
último,
that we
quiero
gathered.
dejarles
Finally, I'd
saber que
like to
nosotros
let you know
lideramos el AHEAD
that we
Interest
are
Group, o
leading
el
a head
Advancing
interest
Health
group or
Equity
the Advancing
through
Health
Social
Equity
Determinants
through Social
Interest Group
Determination
en el
Interest
Centro
Group
Comprensivo de Cáncer. Es
in
un grupo de
the
interés que se
Centro
reúne
Comprensivo
todos
de
los
Cáncer
últimos
in
miércoles de cada mes,
Puerto
donde
Rico. We
invitamos a
meet
diferentes
every
investigadores,
last Wednesday of the
¿verdad? Y
month, where we
profesores de diferentes
invite
instituciones
experts and
académicas
different
y de investigación
teachers
para
and
que
researchers
compartan
for them
información
to
de sus proyectos
share
de investigación relacionados a
information
cómo
of
están
their research
abordando los
related and
desafíos
how they're
sociales de la salud
addressing
en sus
these
proyectos. La
problems
próxima
in their
reunión es
different
el
projects.
miércoles
Next
29 de
meeting will be
octubre a las
this
11 de la mañana, hora
Wednesday,
de Puerto
October the
Rico,
29th,
y vamos a contar
11
con la
o'clock Puerto
participación
Rico
de la
time, and
doctora
we
Omaira
will have the
Salgado, quien va a
participation
estar
of Omaira
presentando
Salgado. She will be
datos sobre el
presenting
programa de
data
prevención y
about the
detección
program of
temprana de cáncer de
prevention
mama y colon
and
de mamas en
early
Puerto
detection
Rico,
of
una
cancer
alternativa para mujeres
in
con
Puerto Rico,
disparidad
an
de
alternative
salud y un programa
for female
que cuenta
population.
con
It's a program that
¿verdad? Una navegadora
counts
de pacientes
with
para
a
las
patient
participantes que
navigator for
están
the participants that
adscritas
have
al
signed
programa. Así
up
que hasta aquí mi
with our
presentación.
program. This
Doy
is it
espacio
for my
¿verdad? Para
presentation.
preguntas.
I hand the floor
Muchas gracias,
to you
doctora
for
Soto.
questions.
Vamos a ver si hay preguntas dentro del público.
Let's see if anybody
Rachel
in
tiene
the
la
crowd
palabra
has
en la moderación.
any question. Rachel, moderate, please.
Sí, muchas gracias a todas.
Thanks to everyone.
Increíble, o sea, yo
It's
diría
been
diferentes,
amazing,
o sea, inspiring, ¿no? Las
very
presentaciones que hicieron,
inspiring
comenzando
presentations.
con ese cuadro general
Starting with that
de Sharon hablando sobre cómo
general
hacer
chart,
las publicaciones y
speaking
todo,
of
y también
Shane,
viendo
and
los
how to
proyectos
publish
increíbles
and
que
seeing these
ustedes
incredible
doctor
projects
Abreu y
that
Soto-Salgado han
you have
hecho.
done, Dr. Abreu.
No
I
sé
would like
si no hay
to,
preguntas así,
I don't know
quería
if there
comenzar
are
con uno
questions.
acá,
I'd like to
de preguntar
make you one that I have here.
inicialmente eso sería más para
This
la
would be a lot
para la
more
licenciada
for
Sharon y luego para ver
Sharon,
si las doctoras
and
tienen
see if
algo
the
para
doctors
añadir
have some
también,
sort of
¿no?
an
Así que
input
disculpe que le voy a
to
hacer
add.
la pregunta en inglés.
So the question will be done in English.
Sharon, I'm not sure if are you still connected? Do we have? Hi, Sharon. Hi, Sharon. I was wondering if, with what you spoke about, I was just curious around, the role of mentorship and, the role of what is mentorship like when you're thinking about relationship with publication and research? Is that something?
That's a great question because you do need someone to take you under your wing. I will say that at the Academy
Yo
Oncology
diré
Nurse and
que
Patient Navigators, we have a
yo
program
dir-
called BOLD, BOLD, and it's about leadership development, but it's on different levels for how do you need to be mentored in your leadership ability. And someone can apply and say that they'd like to publish an article or they have a rough draft of the article and they need help. And they will match them up with someone who has published before and help them get that out into the publishing world in whatever venue they'd like to do. I often have to say that from my experience as being published, sometimes my breath is taken away by some of the comments that come back from reviewers. I will say that when we have the Journal of Oncology Navigation Survivorship, when we look at a lot of those articles and we see that what this writer is trying to say, but they've not quite gotten it out where it can be replicated and duplicated with other people, that we do take the time and we have assigned them editors to work with them to help them bring their work up to that level to where they can get published. Same way when we look at abstracts that go into our annual conferences at the Academy of Oncology Nurse and Patient Navigators. When we get abstracts in, we do give them an outline of how to write an abstract, but some are just not that experienced. So we take the time and send back information and say, can you relook at your abstract? Can you edit it and look at this, what we're asking for? And we give them specific examples and articles to support what we're asking for. And that way, I know this year we have over 70 abstracts that are getting ready to be released next month. So it's exciting to work with young writers and try to make them feel how important they are and recognize the level that they come to us.
Thank you so much. I appreciate that. Para ver si hay preguntas de la audiencia, si no yo...
Any questions from the audience?
La otra pregunta que tenía,
The other question that I had
era
was
para las señoras así, las
for
doctoras Abreu y
Dr. Abreu
Soto-Salgado,
Salgado,
que han hecho sus proyectos
saying that
recientemente de
you've
investigación.
developed these
Lo que
amazing
mi
research
pregunta es, si
projects.
tuvieran
The question
fondos
is, if
ilimitados,
you
o
had
sea, para poder
unlimited
estudiar lo que
funding,
quisieran en
if you
cuanto a,
could do whatever you
¿cuál
wanted to
sería
do,
como su
what would
investigación
be
de sueño, ¿no?
your
¿Qué es lo que
dream
nos gustaría
research?
ahora
What
investigar
would you
después de
like
que han
to
lanzado
investigate and research
sus
after
investigaciones que
you
se han hecho
launched
ahora?
your
Esa es
prior
mi pregunta.
investigations? I don't know if I'm being understood.
No sé si la otra Abreu o...
Bueno, nosotras
Well, we
desde Propacífico, más que investigar, hacemos proyectos de intervención.
so
Si
more than
contáramos
doing
con
research, we
recursos,
do
creo que
intervention.
sería
If we had the resources,
muy
I think it would
oportuno
be very good
para la
for the
región
region,
poder contar
being able to
con un
have
curso estandarizado
the standardized training course
profesional
so
que
that the
ya
staff
ejerciendo la
that
actividad de
nowadays
navegación
it's
pudiera
playing
contar
the role of
efectivamente
navigator,
con una
they could
capacitación
actually
por
have a formal
profesionales que
professional
saben y
training
conocen
by
y que
professionals who
ellos
are familiar
también
with that,
puedan
and for
aprenderlo
them also to
no solo en
learn
la
about that
marcha
and
de
not on the
todos
go,
contra el mundo
you know,
para
like
aprender a
hitting
hacerlo bien y en
the
la medida
wall
en que ellos
to learn
estén
how to do right.
muchísimo más competentes,
And to the
pues su
extent that
ejercicio
they
va a
are
ser
much
muchísimo
more
más
competent,
efectivo.
its exercise
Entonces
will be
creo
much more
que
effective. So I believe
la
that
premisa
the
ahora sería que
premise now
todo
would be
nuestro talento humano a
for
nivel
all
navigación
our human
que está
talent in
haciendo el
our
ejercicio
region
de
that is
navegación contara con la
actually carrying out that
predisposición de ese
exercise of
curso,
navigation
que
could have
pudiéramos
available
tener esa,
that
esa formación
training
competente
so that they
en
could have
nuestras
that
poblaciones.
competent training in our professionals.
Mil gracias.
Thank you.
Doctora Soto-Salgado.
Dr. Soto
Sí,
Salgado?
saludos, gracias por la pregunta. Me
Yes,
parece
thank you for the
excelente. Yo creo que en
question.
el
I
caso
think
de
it's
Puerto
excellent.
Rico
I think that in the
es
case of
algo
Puerto
similar
Rico,
a lo que
is
compartió
something
la
similar to
conversante
what
anterior.
our
Nosotros,
colleague
por ejemplo, no
said,
contamos con capacitación formal.
because
Así que uno
that we
de
don't
los
have a
próximos
formal training.
pasos que
So one of the
nosotros
next steps that
queremos hacer y ya
we
hemos estado en
have
conversación
thought about, and we have been in
con
conversations
organizaciones
with
de navegación de pacientes
the
internacional para
organization
poder
of
desarrollar una capacitación formal para
Patient Navigation
personal,
International
¿verdad?
to
Que de alguna
implement
manera
formal
ofrece
training for
servicios
staff
a pacientes de
that is
cáncer.
somehow
Pero
offering
lo
those services
otro
to
también que
cancer
quisiéramos,
patients.
ya
But the
nosotros
other
hemos
thing that we
podido
would like,
identificar algunas características que
we
esos
have been able
pacientes
to
como tal
identify some
necesitan
characteristics
en
that are
recibiendo
patients that
servicios
are
de
in the need
navegación de pacientes. Así que
of receiving the patient
definitivamente
navigation
quisiéramos
services. So
poder
definitely, we would like to be able
identificar
to
y poder
identify
implementar una
and being able to
intervención
implement an
para
intervention
nosotros particularmente
for
basado en
us,
otros estudios en
particularly
punto de
based on
vuelta,
other
podamos
status, so
disminuir
that we can
el tiempo
reduce the
que
time
transcurre entre el
uh,
diagnóstico y el
from
inicio
a
del primer
diagnosis
curso de
to the
tratamiento.
onset of the
Y
first
sabemos que,
course of treatment.
¿verdad? Basado en la
We
literatura, la
know
parte
that based on
navegación en la
literature,
evaluación
the
de pacientes es
role
crucial
of a
para
patient
que
navigator
ese
is
tiempo pueda disminuir.
crucial for that time to go down.
Hay una pregunta en el público.
Buenos días,
Question here.
doctora.
So thank you very much,
Claudia,
Doctor.
doctora, que está en Puerto Rico y en Estados Unidos. Muchas
Dr.
gracias.
Soto, and thank you
Solo
very
una
much.
preguntita
And
cortica para
just
doctora Claudia
a short
respecto
question
a el Valle del Cauca.
about
Esas
Valle del
23
Cauca, those
instituciones
23
que ustedes
institutions
coordinaron en
that you
el taller de
coordinated in that
co-creación, valga la redundancia.
co-creation workshop,
El formulario único que
the
ustedes
form
implementaron
that you implemented,
quedó en un repositorio común, en una base de datos
is that
o
located
fue
in
algo
a common
manual
repository,
para
or was that
tratar
something
de
manual to
que
try for
esa
those,
información
for that
fluya
information to
entre todos los
flow
actores, el
amongst all the
laboratorio,
different
el
stakeholders,
tratamiento,
the
el
lab, the
diagnóstico,
treatment,
porque
the
usted decía
diagnosis,
que se había mejorado
that
en
you
mama y
said
en
that it had
cervix.
improved in
¿Qué
mama and
receptividad
cervix, in
hubo en
breast and
esas
cervix?
instituciones para
What
que
was the
ellos
receptiveness in those
sean
institutions
voluntariosos
so
en
that they
mejorar su
actually
interoperabilidad en los sistemas de
improve
información, al
in
menos
their
en ese formulario,
interoperability in the
¿cierto?
information systems of
Que la
this
CPS
in
ya
terms of
cumplió
that form?
30 años en el
Because it's
sistema
been 30
y
years of
siguen
the
con
health
la
system,
excusa
and they
de
still
que
have that
no pueden
excuse
tener
that they
una
cannot
historia
have
clínica
a unified or common
electrónica
electronic
y
record,
que no hay plata para ello.
and that there's no money for
¿Cómo fue
that.
esa
So
receptividad en esos
how
prestadores
was
para
that
mejorar
received in
los
those
eventos de interoperabilidad?
providers?
Bueno, tenemos la fortuna
Well,
de
we
contar con
are lucky
organizaciones
enough
siempre
to
muy
have organizations that are always very, very willing.
Adicionalmente,
In
creo
addition to
que
that, I think
pues tenemos la
that
fortuna también de
we
ser
are lucky
reconocidos en
enough
la
to be
región
recognized in the region.
y desde ahí
And
siempre
from that
contar con
point,
la voluntad de las
we have always
organizaciones.
had the will of the
Adicionalmente,
organizations. In addition
tengo
to
que
that, I
decir,
have to say,
son organizaciones muy comprometidas con el trabajo en
uh,
navegación
it's
oncológica,
organizations
con el
that are
trabajo
very committed with the
oncológico.
oncological work, with the oncological
Considero que
organizations.
Cali y Valle
I
han sido
consider that Cali and
pujantes en
Valle
ese sentido
have
desde
thrived in
diferentes
that
iniciativas
sense
que tienen, por
from
ejemplo,
different initiatives that they have
que hay en la región,
in the
registro
region.
poblacional de cáncer de Cali, por ejemplo,
Population of
todas las iniciativas
cancer in
que
Cali and all the
desde
initiatives that
se ha
are modeled.
posicionado el cáncer en
So
la agenda
cancer
pública.
has
Entonces, la
been well
disposición
positioned in the
ha
public agenda.
sido
So
mucha, bastante. Y la información la tenemos
well, the
nosotros
will is
como
very good. The information is
organización
owned by us as
concertadora, pero
the
todo lo que se construye desde
organization,
ProPacific
but
se
everything that is
comparte a
built
las
from
secretarías
ProPacific
de salud.
is
Entonces,
shared
esta
with the
información también
Secretaries
la
of
tiene
Health.
Valle,
So
Cali
this
y Valle.
information is also owned by Valle, Cali.
Muchas gracias.
Thank you very much.
Si nos queda corto el tiempo, quería nomás así
Okay,
avisarles.
so I just wanted to let you know, yeah, we're running out of time. I just wanted to remind you that NPI has a journal that you can see online, or for those who are on site here behind. So you have the QR code and you can access that. And we are always looking for participants, navigators to send articles. We would love to publish what you're doing, your stories. So please, you can send what you're doing, and also for the other people, the other speakers, they also have their pages and sites there also that you can
Muchísimas
look at it.
gracias a nuestras
Thank you
invitadas.
very much to our guests.
En
On
el
the
ingreso al auditorio van a encontrar un coffee para que se
door
tomen unos 10
outside the
minutos
auditorium,
para café
there's
y los
coffee, so
esperamos
that you
nuevamente
can
para
take a
continuar.
10-minute coffee
Muchas
break,
gracias.
and we will wait for you here in 10 minutes. Thank you very much.